Center na sebenarnya.
Now we can move to the wellness center.
Sina health desk one.
Sina health desk.
How many people will work here then? Services.
16.
Okay.
And the support staff is from different sectors like demand project,
Okay. And 16 full-time.
Please come. Bonita, please escort. Please come in. So here we have training on the skill building, beauty parlor, tailoring, various
programs
other
and
related aspects.
income generation programs also will be conducted by the
Yeah.
Lovely space.
Yeah. And this will be the so from here.
very soon after this today, and we are planning to do some beautification also here. Providing services for men can be happy to come here, for making them comfortable, making something in an environment for community.
Or a beauty parlor center. But if there are any health needs, then the client will be.
We go this side. Yeah, please come.
So please go there.
Now this is actually this is counseling room. We will provide counseling here.
Here, would they go there first and then be referred here, or could they come here first, or?
When come there, so we will set up the settings. So for this planning to set up a solution stage, when every kind is coming here, we can have them. And if you want to
That's
More dedicated space here?
Yeah, as per the needs of the community, we will refer them to different places. We will refer them and linkage them with different services. The community who come to the Jennings, they will access the community, assess the community need. Then they will refer to other places, and they will refer to here also for the accessing these available services in this center. Then, if after assessing, after deep analysis of their assessment, then we will refer them to other places.
Bio typing and RX typing will be having, and URL analysis also will be having as a point of care testing. And currently we are having only for the HIV and RP. We are ready with all the documentations, like about laboratory registers and all, which is as per our SS on paper. So we have everything in place.
Wonderful space, yeah, it feels very comfortable and welcoming, and I think it'll be a wonderful asset to the community, yeah.
I think all the communities will comfortable to come here, and if you want to take some services like feminization procedures, see, if service is not available here, we can refer to the Caesar Hospital,
Yeah.
and Jennings Hospital also that's nearby.
It's a
Yeah,
good
other private
location.
facilities also. We have already linked up with them. We have worked with them, and we have agreed to tie up each other.
Oh, good, okay.
Regarding the human rights, also we can refer to Masalsa, Manipur
Legal Services Authority.
We have those relationships already established, wonderful.
Sir, this is
We just wanted to introduce you to this amazing lady. She is the landlady of this place.
Oh, okay, very good.
She ensured that this got done in 2 days' time.
Wow, that's fast.
She, her daughters and her son, they worked last night till 2 o'clock.
Yes,
Oh,
Yeah.
wow.
On behalf of community, I would like to thank Madam because she is giving us a wonderful, such a beautiful place for the community. I'm very thankful. You see.
So we wanted a space that is community friendly, and there's no stigma towards the community, and she's like been a
Our
role model.
entire family is very supportive to
Yes,
the
yes.
transgender people.
Yes, yes.
She knows a lot of transgender people from various hill areas because Manipur is hilly area, remote area, and she has assured that she will, on her capacity, will also get lot of transgender people to access the services here. So in getting space in Manipur is so difficult because you have to pay a very heavy amount of deposit. But she made a change for us, and on the advance of this, she made it happen. So this entire space. So last time I came here on 26th of February, and that time this was under construction. So in 2 weeks, this place is getting set up by her. There were so many laborers. She was alone.
And she herself
handling.
was doing it.
It's a wonderful size and good location, and yeah, a very warm, welcoming feeling.
So right now we would require a lot of support from various other departments to get this going. So like for example, we've been talking to MSAC's madam also, PD madam also.
She's here.
And if there's madam is here. With the welfare department so that we can start a skill building program, maybe a small shelter home for trans people over here because we have a space, especially the transgender people who are into destitute, doesn't have anywhere to go. Old age transgender people, we are also tying up with district state legal aid authority so that they can legal services can be provided, and at the same time one of the thought process or dream is to initiate a free of cost gender transition surgeries for transgender people in public hospital, because right now they are going all the way to Trivandrum, Kerala, Karnataka, Delhi, Kolkata for having this surgery, and it is very expensive. It could cost approximately 3 to 3.5 lakh rupees, and they don't have that kind of money because they've been thrown out from their families at the age of 12 or 13 years of age. So they have nowhere. Right now, the children who are thrown out from the family, they take support of beauty parlors to survive. So we hope that with this center we will be able to give them employment, education, various other states, sir, with your due permission, I would like to say, various other states like Delhi, Maharashtra, Karnataka give pension schemes for transgender people. In Chhattisgarh, transgender people are part of the law enforcement agency. They are part of the medical fraternity and also other things. I think, sir, Jenin you went right now. In Jenin, there is a transgender doctor who is serving corona patients. So Manipur is way ahead. I think we need to just take that one more step to get the community sort of part.
That's
of
why
this event.
exactly. It has to be in a proper. Then with the data and the thing, the government can take further with the social welfare department or whatever. Then things can proceed ahead. Unless we have a proper data. Because as I said, I literally took the special interest to find out how many in the elected roles. There were only 94.
97, only 97. Yeah, it's very.
So
there was a mistake in the enrollment of the election process because of technical problems, I should say. But in the next time we will try our
yes,
best.
so it has to be things since that has been included in the column. So that will really help in the government take up steps.
So for that matter, I think even in the add another column for the
Yes,
TC.
yes.
Otherwise, we have just male and female, no? So we can't capture the disaggregated data. So actual data we can capture from that also, apart from the electoral rolls. Yeah, only if we make a small change in the registers and records maintained and the various health facilities in order to capture the real data, no? For others or transgender, apart from male and female. So the health facilities also.
And other than that,
But this is gonna.
other than
But
that,
anyways, was one step at a time, so things will keep moving forward. Hopefully.
Thank you so much.
Thank you so much.
And thank you so much, Patrick, for joining us here. This is really
So let's start.
This way.
Not very good, no?
Good afternoon. May I kindly request everybody to be seated. We are supposed to start the program now. Can we close the door behind? And maybe, yeah, we are waiting some more community members and they will be arriving soon. So we'll just start the program. Thank you so much for all of you gathering here. Some logistical announcements I would like to make. The washrooms are there outside. Kindly requesting everybody to please keep the mobile phones on silent. Kindly put your mobile phones on silent so that we don't hamper the live telecast of this event. Thank you so much. On behalf of the Marupulai Foundation, a community-based organization working with transgender community, Nupi Manbi and Nupi Manba, Share India, iTech India, Manipur State AIDS Control Society, MSACS, and the vibrant transgender community of Manipur. We would like to welcome you for the worldwide launch of the first transgender health and wellness center of Northeast India in Manipur, Imphal. Can we have a round of applause, please? Thank you so much. We are extremely pleased to invite our esteemed dignitaries and we extend our heartfelt welcome to all of you. I would also like to welcome vibrant transgender community who has come all the way over here from various places of Manipur for this historical event. We are thankful to all our stakeholders, donors, community members, advocates, well-wishers who have joined us virtually. This event has been live telecasted on Facebook across the globe at this point of time. So it is a very, very proud moment and I would like to welcome all of you. Globally, an estimate of 19% of transgender women are living with HIV. Globally, the chance of acquiring HIV is 49% higher to the transgender women than all the adults' reproductive age. In Manipur, among the men who have sex with men, we have seen around 8.40 HIV prevalence, so you can understand the vulnerabilities of the transgender people at this point of time. The transgender people in Manipur are unique, the community is unique, and it's also recognized by a very distinct name. The transgender women are being called as Nupi Manbi, and the transgender men who are there here are called as Nupa Manba. Several structural barriers such as stigma discrimination, gender-based violence, family rejection, absence of social welfare, internal stigma around gender and positive status, healthcare stigma and rejection from the society make the transgender community suicidal, vulnerable for the health diseases, and missing aspirational values. There is an urgent need to provide a holistic wellness response that will balance the health, social well-being, and human rights under one umbrella for our sisters and brothers. Trans men are ignored from the HIV responses over the last 2 decades. And however, the global data that denotes, that talks about it, that within trans men who transition from female to male also, there is a 1% of HIV positivity. So we are also talking about a very important perspective here that needs to be addressed. iTech India, in collaboration under Sunshine Project, supported by National AIDS Control Organization, Manipur State AIDS Control Society, and with support of the CDC PEPFAR, is committed to work towards improving HIV services to our most vulnerable key population, such as transgender people. Transgender women among population mostly heavily affected by HIV, Sunshine Project is using innovative, community-led, futuristic, and scalable prevention and care initiatives that will help Northeast and Maharashtra, Mumbai to achieve 90-90-90 fast-track goals, which has been denoted by UNAIDS by 2030. We are extremely pleased and proud to have such an influential and important dignitaries today for this auspicious ceremony. For the several, including myself, Transgender Health and Wellness Center was a dream come true. It will strengthen the trans movement in Northeast and give several vulnerable transgender communities dignified lives in the mainstream society. We would request following dignitaries to kindly come for a lamp lighting ceremony so that we can officially launch this event. May I kindly request Honorable MLA and Advisor to the Health to Chief Minister of Manipur, Dr. Sapan Ranjan Singh. Honorable Principal Secretary, Health and Family Welfare, and the President of MSACS, Mr. V. Vyumlung. Honorable Consul General, U.S. Consulate General, Kolkata, Ms. Patty Hoffman, Madam. Honorable Director, Division of Global HIV and TB, CDC India, Dr. Melissa Nenhak, Madam. Honorable Project Director of Manipur State AIDS Control Society, Ms. Hobon Rosita, Madam. We would also like to invite, can we just have a round of applause, everybody, please? This is a very, very historic event that we are having of inaugurating. Can I also request Ranjit, please, to join in stage with the dignitaries? Shanta Kurai, please, can you come in on the dais kindly to join the dignitaries? And Tilottama, who's our community advisory body member, please kindly representing the trans men. Thank you so much. We also have 3 dignitaries on virtual platform, Dr. Alok Saxena ji, Madam Shobhini Rajan, and Ms. Nandini from UNAIDS. So we would also like to, kind of appreciate them for being available for this event, and thank you so much for making this. This is such an important event. For a longest period of time, Northeast India was looking forward for a specific transgender interventions that could provide health, wellness, and empowerment to the transgender men and women in India. And we are extremely proud to have this event today with the grace of all the dignitaries here. I'm also going to request Ranjit, who is the president of Marupulai Foundation, can you please kindly come here and give the token of appreciation, the souvenirs to our guest of honors here? Marupalai Foundation, please come, Ranjit. Marupalai Foundation is the community-based organization who is going to implement this Transgender Health and Wellness Center in Imphal. This is a very unique initiative where we are trying to bring all the services under one umbrella. Thank you so much for the patience. We are just making the logistical arrangements, and very soon the dignitaries will receive the souvenirs. The souvenirs are very, very unique. I was seeing the souvenirs, and the souvenirs are the instruments of Manipur culture, and at the same time, the souvenirs represent the Manipur god who reborn as a beast. And henceforth, these are very unique souvenirs that we would like to give it to you. And this will be a very, very important aspect in your culture. So thank you so much for the community members. So I'm going to request Honorable MRA and Advisor to Health Chief Minister Dr. Sapan Ranjan Singh. Thank you so much. Can we have a round of applause, please? Come on. Pep up, everybody, please. We are going to felicitate now. Thank you so much, sir, for being here. It's a real pleasure. And we are missing right now our NACO officials also, who are there virtually joined us. Now we are going to invite Honorable Principal Secretary of Health and Family Welfare, President of MSACS, Byumlang. Can we felicitate, sir, please? Thank you so much from the community. This is a respectful felicitation happening. A souvenir has been given to sir for being a huge support to the community. And now, Ms. Patty Hapman, Honorable Consul General, U.S. Consulate General, Kolkata. Thank you so much, madam, for being here all the way and being part of this historical event. I don't think so this event would have been possible without you. This is a small token of Manipuri culture and love and affection towards you. We would like to thank Dr. Melissa Nendak, Madam, Honorable Director Division of Global HIV and TB, CDC India. Can we please felicitate ma'am? Thank you, Dr. Melissa, for being a huge support to the transgender issues. Thank you so much. And of course, last but not least, our own dearest Madam Haubam Roshita, Project Director of Manipur State AIDS Control Society. Madam is the instrumental person. I have never seen a person who has been so dedicated to the trans right and providing lots and lots of support. Sir. I would like to request community to felicitate Sir T.H. Bhimo. And Dr. Lokeshwar, Sir MS, Medical Superintendent of Jennings. Without this would have not been possible. Sir has been extraordinarily supportive. This is the first center ever been situated inside the public health care facility. In the Asia Pacific, you have not seen some kind of services like that. By providing this facility to the transgender community, sir has made a history and put forward a huge amount of step towards the perspective. Yeah. We would also like to felicitate other CDC guests who are here all the way. Please kindly stand on your place so that the community can come to you, reach to you, and felicitate you for the wonderful contributions you are having towards the transgender community. Mr. Ryan, Dr. Sudhir Chawla, Dr. Ramesh Alam. And at the same time, virtually we would like to appreciate and we would like to felicitate Dr. Alok Saxena ji, Dr. Goyal, who's here online. Can we have a round of applause for Dr. Goyal, please? Thank you so much, Dr. Goyal. And Dr. Shobini Rajan. Ma'am, we miss you here. You would have been here. Thank you so much, ma'am. Yeah, we would also request community to give a token of appreciation to J. Srinivas ji, our Director Prevention, ITech India, and Pankaj ji. Where are you? I can't see Pankaj ji. Pankaj ji, can you come ahead, please? Yes, and Pankaj ji is our Northeast in charge from ITech, an amazing person. Such a visionary person who's been doing extraordinary work in the entire Northeast from ITech. Thank you so much, the community, for appreciating everybody. So let's take the program ahead. Thank you so much. I just want to check if the cultural troupe is ready. Can somebody give me a check on cultural group? But meanwhile, till the cultural group joins, okay, so till the time the cultural group joins us, I'm going to make a small presentation talking about our effort of ITech India and Marupulai Foundation. Can we have a presentation put up, please? Thank you so much. I think this is the work in progress. We have done this in the last 6 months. There has been several consultations that has happened with the community, with the officials, with the networks, with the community leaders, policy people, and lots of people. And you see the first hand. Today we are going to inaugurate 2 specific units. One is the health center and the wellness center as well. And this is the presentation that I'm going to put up a little bit about our work. You know, everybody talks about the transgender vulnerability. It has been talked about several times, but many times the transgender people have been always considered as a transparent glass. So you see me, but you don't want to recognize me. Like, for example, transgender people are there. You see across the table, there is a lot of transgender people are sitting here. But when we talk about the policy discussions, when we talk about the engagement on health responses, when we talk about the human rights, or when we talk about the identity, we still don't have the existence for the transgender people. And I think you and me, who are the trans allies, has to come forward and do something about it. UNAIDS also talks about the vulnerability of transgender people on HIV. WHO, World Health Organization, also talks about it. In fact, the Sustainable Development Goals of WHO, which talks about the gender equality, poverty, various gender-based violence, several other sustainable goals that the global community has agreed upon, is incomplete unless and until you work around and look into the vulnerability aspect of transgender people. NACO, National AIDS Control Organization, for last more than 2 decades have been working extensively, and in last 10 years, NACO has been extremely supportive to the transgender community. As a result of that, in 2014, 15th April, transgender community was first ever recognized as a third gender by the Ministry of Social Justice and Welfare. And now it is important that we move forward about it. Now, what we need to understand that when we talk about HIV, TB, STIs, or various other diseases, we cannot ignore the other issues of transgender people. Because these issues are interlinked, and they are complicated, and they are interconnected. For transgender community, for us it is health because we are part of the health perspective and we are talking about the health strategies and health policies. But for the transgender community who is still surviving on a petty amount of money, who doesn't have enough money to eat the food, who doesn't have a shelter, who is struggling with the gender identity, every day facing a huge stigma and fight among inside of them, that they are trapped in a wrong body. For them, health comes later. What comes first is their basic needs. What comes first is their gender transition. What comes first is their gender. So I'm trying to say that unless and until you work around this side of the work, I don't think so your HIV response or STI response can be completed. Because, for the community, that is not a priority. But for us, as a strategist, we must look into the holistic response, and that is what this center is going to look into prominently. Now, we have studied several units which has been done across the globe. We have studied clinic initiative in UK, we have studied Tangerine Clinic in Thailand, we have studied Fenway Institute in America, several institutes, and we come across that these are the prominent service these all clinics were offering to the transgender peoples. Transgender people across the globe are connected. They have common threads of the issues that needs to be addressed. On one hand, we talk about the prevention service and care services, but at the same time, we cannot ignore gender-specific support that will include a various gender response and cannot forget about the mental health, which is a very, very important, and the welfare. But the most important part about is that this has to be a community-led approach. So transgender community cannot be just a beneficiary, but they have to be designing the strategies, they have to be the implementation of the strategy players, and at the same time, they have to be also responsible for the outcome of the program. So based on that, iTech India come up with the operational module, and we thought about that we need to work around the direct services and indirect services. And these direct and indirect services both are important because, we are working under the bigger umbrella of HIV. There is something that we can do, there is something that we have to get help from. And there is help available already. NACO itself has done a collaboration with 11 government departments and various ministries. And I think this is the time when we have to utilize that. It is important to do that. I look forward in Manipur where the Manipuri transgenders will fight the elections, forthcoming election. I look forward for the opportunity where the party's agenda will include the transgender people in forthcoming election. So, we have to have a conclusive approach within that. And we said that we need to have a referral linkage, and at the same time, we also need to have approach towards building their capacity. So the work that we are doing with the transgender people is sustained. And that's the reason this entire initiative was woven with the Marupulai Foundation, which is a community-based organization to carry forward. And we have also taken various partners on the board. There are two types of facilities. So right now, after this inaugural event, we will be actually going to Jenim. And thank you to Dr. Lokesh, who's sitting here, who has been extraordinarily supportive. Because of PD Madam and Dr. Lokesh and various other people who's really helped, for the first time in India, we managed to create a separate room for transgender people. Why it is important? Everybody will think about it, right? Because, there's a data that talks about it that transgender people face huge amount of health stigma. Doctors are not stigmatizing them. Maybe doctors are not stigmatizing them. But the stigma is faced at the every level. It is faced at when they enter into the health facility. It is faced when they are admitted into the hospital. It is faced when they are accessing the healthcare services. And to do that, you need to have a transgender person within the healthcare system who can completely sensitize the entire system. And that is the effort that we are trying to do. So you are going to inaugurate that, and we will be providing a lot of services on that health desk. There will be 2 transgender people who will be sitting there. Nikki Berry, who's our community nurse, and Roro, who's our peer advocate, who will be sitting there. And at the same time, just outside the public health setting, we have created a wellness center. Now this wellness center has various services that you will see it across, and I will just help you to glance through it. These are the services that will be provided under the wellness services. So we are talking about a community friendly space, but along with the community friendly space, we have a huge feedback mechanism. Tilottama, can you get up? So Tilottama is one of our community advisory member, and that just like him, there are 3 more members. This is the first ever community advisory board which has been established, which has trans men, trans women and intersex people. Very unique thing for the HIV response. It has never happened before. Thank you, Tilottama. So we have a community governance board who's going to governing the entire process. We have a mental health professional who is going to provide mental health services. Share India, Dr. Nanjam, and who, if you are here, wherever you are. So Share India has come up as a partner, and they are providing a range of testing facilities for transgender people. We are looking into a specific support on capacity building. So for the first time, we are also building skill building for the transgender people. There will be a beauty parlor inside this wellness center for transgender, young transgender people to come there and access the services. We are working with the private healthcare facilities to provide basic laser treatments and hormonal therapy, which is a very, very important aspect for gender related support. And at the same time, we are also working with Sathi. Dr. Ramki is here, Randoni is here, Shanta is here. Thank you so much for coming. We are also exploring with Sathi and Salsa how can we actually provide a legal support to the transgender people with the help of their already working initiatives. So these are the testing facilities that Share India will be providing explicitly. So it is not just about HIV, but when the transgender person walks into the laboratory, that person gets the holistic HIV, along with that various other health responses, which is extremely crucial. These are the services that we'll be providing on mental health, health support, laboratory services, welfare and linkages. So you see a big umbrella of services that will be provided for the transgender people. Why? Because we want transgender people to have a health-seeking behavior. So it's just not about HIV, but along with HIV, a trans person becomes more, aware about their own rights and health, and at the same time, they also become more prominent about it. Various outcome indicators that we are really looking forward when it comes to the transgender related work. This is inspirational work, and we see that this community-led initiatives will be taken forward. Thank you so much for this, for your kind patience, and very soon you will be actually seeing this entire initiative in presence. So thank you so much. I'm going to request the logistics department to come and remove the presentation. Yes, now. Okay. So can we request, please, to, this is a very important thing. So now we are going to officially launch the Transgender Health and Wellness Center and Help Desk. Yes, we are just waiting for the event to get live, and somebody says thumbs up to me from there once it happens. Yes, no? Faster? Kindly bear with me. So I'm going to request now, are we on live? Okay, so I'm going to request now our chief guest, Dr. Sapan Ranjan Singh, sir. Please, can you come on the stage to unveil Miss Patty Halfman from Consul General, U.S. Consulate General. Yeah. V. Vyumlong, I'm really, excuse me for that. V. Vyumlong, sir. Dr. Alok Saxena, I hope you are there on live session. Dr. Shobhi Ranjan, I hope you are there. Dr. Melissa, can I request you to come please on the stage? Yes. So everybody, cameras ready? Everybody is ready? Are we going to do that? Yes. So may I kindly request dignitaries to please unveil the Transgender Health and Wellness Center. Can we have a round of applause, please? Louder, community, please. Come on, you can do it much better than that. Thank you so much, sir.
Transgender Health and Wellness Center, Manipur, launched by Dr. Sapan Ranjan Singh, Honorable MLA and Advisor Health to CA Manipur, in the presence of Sabir Budi Gungunmang IAS, Principal Secretary Health and Family Welfare, Government of Manipur, and who is also the President of MAX, and Sri Alok Saxena, who has joined us virtually, and Ms. Patty Hoffman, Consul General, US Consul General, Kolkata, and Dr. Melissa, Program Director, CDC India, on Thursday, the 25th of March, 2021.
Can we have a round of applause for Dr. Shanti Bela, HOD Psychiatry Department? We just had a meeting and Dr. Shanti Bela has assured that she will be providing a huge support to the transgender community who's at the Jenim. Thank you so much, ma'am, for coming here. Thank you. Thank you so much, Bonita. Can we have a round of applause for Dr. Shanti Bela, please? Thank you so much. Thank you. Dr. K. Saroja, Deputy Director, Social Welfare is here. Dr. K. Saroja, thank you so much. Thank you so much, Salsa Sathi, for helping us in this regard. Thank you, Dr. K. Saroja, for being here, Deputy Director, Social Welfare. We're really pleased to have you. Dr. Romila Dako, Imphal East. Can we please request to community to felicitate Dr. Romila? Thank you so much. Please come forward. Thank you so much for being gracing this occasion. Quickly, please. Thank you. Yeah. Dr. L. Rai Chandra, Dako Bisnupur is here. Round of applause for Dr. Rai Chandra for being gracing the event. We are having lots and lots of transgender ally people over here who's going to support this initiative. We're really thankful to them. And last but not least, virtually, I would also like to thank Dr. Anwar Parvez, who's our country director of iTech India, who has been a huge support and the air behind our initiatives. This would not have been without him and also our iTech staff, who's been extremely supportive.
So thank you so much, everybody. Now, take your weight from your feet and be seated and have a glimpse of cultural event will be performed by our community performers. So I would like to call upon the community members who are going to perform the Maibi dance. It is a ritual performance dance which is done in Lai Harauba related to incarnation of the human body. And this is a very, sacred and spiritual dance. It is related to human incarnation. The work which will be done by the society, it's related to the society, the human, thinking associated with mind, soul, body, and everything. So may I now present before you the Maibi Jagoi, which will be performed by the community transgender members. Thank you so much, Nupi Manvi Cultural Troupe, for your powerful and energetic performance. Now, I profusely elected to take an opportunity to introduce Madam Haubum Rosita, Project Director, to give welcome speech of this event. Madam Haubum Rosita is the Project Director of Manipur AIDS Control Society. So may I take the opportunity to give welcome speech over here.
Respected Dr. Sapam Ranjan Singh, Honorable MLA and Advisor held to Chief Minister Manipur, Sir V. Nungmang, Principal Secretary, who was just with us a short while ago, and who is also the President of MAX, Sri Alok Saxena, Joint Secretary, NACO, Ministry of Health and Family Welfare, who is joining us virtually on this occasion, Ms. Betty Hoffman, Consul General, US Consulate General, Kolkata, Dr. Melissa Yandak, Director CDC India, and the CDC team, officials of NACO who have joined us virtually, and also Dr. Anwar, who is joining virtually, I guess, Dr. Srinivas, and the whole iTech team, Director of JNIMS, Dr. Bhimo, Dr. Lokeswar, MS of JNIMS, professors and doctors of JNIMS and RAIMS, officials and staff of MAX, Maruploi Foundation, our friends from the transgender community, friends from the media, ladies and gentlemen, on this auspicious occasion on the launching of the Transgender Health and Welfare Center at Manipur, I, on behalf of Manipur State AIDS Control Society, extend a warm welcome to Sir Dr. Sapam Ranjan Singh, Honorable MLA and Advisor held to CM Manipur, for being with us today as chief guest and for taking a lead role in this launching program. I also like to welcome Dr. Alok Saxena, Joint Secretary, sir, who is joining us virtually. I also take this opportunity to extend a warm welcome to Ms. Betty Hoffman, Consul General, US Consulate General, Kolkata, and Dr. Melissa Yandak, Director, CDC India. I also welcome Dr. Srinivas and the whole iTech team, and a warm welcome to all the dignitaries, officials of CDC, iTech, our transgender friends, and everyone present here on this occasion. Once again, on behalf of Manipur State AIDS Control Society, I extend a warm welcome to all of you on this launching program. Thank you.
Thank you so much, Ma'am Haubum Rosita, for keep supporting me. Next, I would like to invite our most beloved and huge support in National AIDS Control Organization, Dr. Savini Ranjan, Deputy Director General, National AIDS Control Organization, responsible for prevention, research, and strategic information in India. So now, Dr. Savini Ranjan, you may now take your mark.
I'm really happy to be here, except that I'm a bit jealous that all of you all are enjoying this physically while I'm joining it virtually. So, dignitaries, the chief guest, Dr. Sapan Ranjan Singh, V. Vyumlung Mang, Haubum Rosita, Ms. Patty Hoffman, Dr. Melissa Niandak, all my friends from implementing partners, iTech, all my beloved friends from the community, especially Abina, Roro. I'm indeed very happy to see that we are launching a comprehensive transgender clinic and a wellness center in the public sector. And for us in HIV/AIDS, transgender persons, although they comprise the high-risk group for HIV infection, we look upon them as a really important community. While our estimates amount to only 70,000 transgendered populations, as per the mapping estimates done in 2013-14, we are well aware that there are many of our friends, many more than these numbers. And our HSS says that there are 3.14 per lakh prevalence rate in this, 3.14% prevalence rate in this population. Now, although we run targeted interventions program and there are 38 exclusive and 252 composite targeted interventions for the transgendered population, we have, by means of revamping, invited more of the hard to reach and comprehensive populations to come and access our TI sites, and new populations to reach out to us, as well as avail services of community-based HIV testing, as well as community-based services for treatment. NACO has had communities at the center and has had them at the anchor of our programs. And our strength has been that the transgendered community has always been part of our planning, monitoring, and implementation of interventions. We have an exclusive technical resource group for transgendered persons under the National AIDS Control Program. And the last meeting of the transgender TRG encouraged us to set up a working group which would actually deliberate on the standards of gender affirming care for this population, as well as look at various modalities of integrated service delivery. But what I'd like to congratulate the project and the community for, and especially the state of Manipur and the functionaries for, is that you have actually made it happen even before we have been able to start thinking and putting our process together in terms of the documentation. So I think you all deserve a very huge round of applause for this important day where you are launching this Transgender Health and Wellness Center in the Jenims called Sunshine Clinic, very aptly. I'd also like to make special mention of the fact that our leadership at National AIDS Control Organization is very sensitive to being able to cater to the health needs, not only the HIV AIDS prevention focused health needs, but more comprehensive health needs for the LGBTQIA plus community as such. And in this regard, the leadership is trying to take steps to establish certain centers of excellence for gender affirming care in premium institutes under the government, as well as work towards integration into the medical curriculum content which is appropriate and sensitive to communities. So with this, I congratulate Center for Disease Control, the PEPFAR, the ITEC team, and Manipur SACS, and all our community members for this very important and path-breaking initiative. I wish this endeavor and this clinic grand success. Thank you.
Thank you, Madam Dr. Sobhini Rajan, Deputy Director General, National AIDS Control Organization. And next, I would like to invite another important trans ally, an amazing advocate in UNH who has been fighting for the trans inclusion side by side along with the community members. I would like to introduce and invite Madam Nandini Kapoor Dhingra, Senior Program Advisor UNH. She has been supporting the community for the exclusive and holistic trans response in India for several years, and she will be joining us virtually. Yes.
Thank you. Good afternoon, all dignitaries and friends. I would like to convey greetings from UNAIDS, and thank you for inviting UNAIDS to say a few words on this very important day, which is the opening of the Transgender Health and Wellness Center. We are very pleased to participate in this very important event, which is being telecast globally. As Abina earlier said, this is truly a historical event and a very, very important day for the community and for all of us. As Dr. Shobni rightly said, we envy you all being there physically and we having to join virtually. But I must say, I still feel the excitement in the room through the Zoom call. The Health and Wellness Center, as stated by Abina, is a dream come true for several community members. It is a joint effort of the community, the state government, and the partners. This is an excellent collaboration. The center is going to be a safe place for our friends from the transgender community where they would get holistic support and care for their health and well-being. What is most important is that the center will provide holistic care and cover all the basic needs of transgender people. As we heard earlier, there are issues which go beyond health, which are more important for the community and need to be addressed along with the health needs. We know there are different reasons why the transgender community may not visit healthcare services. This dedicated clinic would address those issues and encourage the community to access the services. As we heard, this is a community-led initiative which will be a single window for all services for transgender people. It is the way to go. As we know, we have made a lot of progress and come a long way. In the last few years, the Transgender Act, the Transgender Council, the shelters, and now the Transgender Health and Wellness Centers. These are all demonstrating to us the progress we have made along with the transgender community. And I'd like to add that it has been really the community which has been leading these initiatives. There has also been a lot of progress on the social entrepreneurship, providing more opportunities to the community for economic activities. Therefore, health, well-being, economic empowerment are the critical areas which need to be covered to be able to have a life of dignity for the community. The center will provide not only a safe space, but also a sense of belonging for the community. This initiative is an example of community and state partnership, community ownership, and holistic care. On behalf of UNAIDS and Dr. Bilali Kamara, the UNAIDS country director, who could unfortunately not join, I would like to wish all of you there all the very best and hope to see you all in Manipur very soon. Thank you. Over to you.
Thank you so much, Ms. Nandini Kapoor, National Project Director, Senior Program Advisor of UNAIDS. And next, we'd like to have Dr. Melissa Nadiak. We have our strength in our wings to make the dream for transgender community in Northeast, because we have an amazing angel sitting inside the CDC India. She is none other than Dr. Melissa Nadiak, Director Division of Global HIV and CDC India.
Too many things here. Glasses, masks, okay. So, Mr. Alex Saxena J.S. Nako, Dr. Shobani Rajan DDG Nako, Dr. Naresh Goel, Mr. V. Vumlungmang, Principal Secretary, Manipur, Dr. Sapan Rajan Singh, Honorable MLA and Advisor Health, Ms. Nandini Kapoor, UNAIDS, PD Manipur Sachs Habam Rasita, and Ms. Patty Hoffman, U.S. Consul General, Kolkata. Community and colleagues on and off the dais, I'm so thrilled to be here today. On behalf of our CDC team and the U.S. President's Emergency Plan for AIDS Relief, I'm delighted to be here with you today on the inauguration of the Transgender Health and Wellness Center in collaboration with our implementing partners, ITEC India, Share India, and also implemented by the Marupalai Foundation, Manipur AIDS Control Society, and NACO. I've been to Manipur several times, and it's just a joy to be back with you all again. For over 20 years, the U.S. Centers for Disease Control has experienced a highly successful technical collaboration with the Government of India to address India's public health priorities, including HIV. As the only U.S. government agency with an exclusive focus on public health, CDC India has collaborated with NACO on impactful programs in HIV prevention, testing, treatment, and lab system strengthening. Today, we're here to talk about client-centered approaches, which are really the cornerstone of impactful programs. Put simply, programs that are for communities and by communities are recognized across the world as the need of the hour. The Transgender Health and Wellness Center and the Health Desk at Jennings is such an exciting model of inclusivity and gender-affirming health services. Wellness, as you all know, has many parts, including mental and physical health, social well-being, as Abina rightly said, and it's not merely the absence of disease. Transgender people have been disproportionately impacted by HIV, and building on concepts of integrated strategies to decrease stigma, structural barriers, and increase health access, it's exciting to see this center offering such a holistic approach to health and wellness with essential services across the HIV prevention, testing, and treatment continuum within a gender-affirming framework. I'd like to congratulate and acknowledge all the work done by NACO in convening multiple technical resource groups on transgender health and for their incredible support and guidance on the concepts of the integrated package of services. And congratulate and thank the Manipur SACs and the government of Manipur for their support moving everything forward. And finally, a special thank you to all the community members here today for their advocacy and vision to make this center a reality for truly innovative programming. And in closing, I'm reminded of one of my favorite quotes from an acclaimed American poet, Maya Angelou. Be a rainbow in someone else's cloud. I know the center, with the committed staff and community and with the support of NACO and SACS, will be that rainbow for many people. So on behalf of us at CDC, thank you and congratulations on this wonderful day.
Thank you, Dr. Melissa. And today, we have very important and distinguished stakeholders and dignitaries with us. Now, I would like to request Ms. Patty Hoffman, Consul General of U.S. Consulate General, Kolkata, to kindly present and kindly grace the transgender community of Manipur, and please kindly share your perspective about the transgender health and wellness response in India. And please share Madam's experience also, please.
Good afternoon, everyone. It's really an honor to be here. I'm very excited about the inauguration of the Transgender Health and Welfare Clinic, and it's a wonderful afternoon. I'd like to acknowledge Joint Secretary Shri Alak Saxena, Ms. Habom Rosita, Project Director of Manipur SACS, and dignitaries in the room, as well as all of the community members here today. I'd like to offer my congratulations to NACO, Manipur State AIDS Control Society, community members, and the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, for launching this innovative project. This successful inauguration today demonstrates the strong partnership and health cooperation between the United States and India. It's wonderful for me to be back in Manipur, having joined our former U.S. Ambassador Kenneth Juster on a visit before the pandemic to learn about the collaborative efforts under Project Sunrise for community-led approaches for service delivery. It's exciting to know that the productive work funded by PEPFAR is continuing and growing under Project Sunrise. And today's clinic launch is one of the many successes of a strong partnership between NACO, the state AIDS control societies, communities, and PEPFAR. Since 2003, the U.S. PEPFAR program has helped save more than 20 million lives in more than 50 countries around the world. Through outstanding partnerships, year after year, PEPFAR has accelerated global progress toward controlling the HIV/AIDS epidemic as we know it. NACO has shown great leadership in India's HIV response, and NACO's evidence-based, community-centric strategies have shown remarkable progress in India's endeavor to halt and reverse the tide of the HIV epidemic. India saw a decline of 37% in new infections between 2010 and 2019, and in fact has achieved an 86% decline in new infections since its peak back in 1997. NACO has launched a multi-pronged response to address prevention, testing, and treatment and access towards epidemic control. NACO has been a model in the region for putting communities at the center and for partnering for effective response to HIV. As transgender persons are disproportionately impacted by HIV, a clinic for the community and informed by the community is an exciting step forward. I thank everyone for their hard work in making this clinic a model program which will provide valuable lessons throughout India and the region. Here in Eastern and Northeastern India, our U.S. Consulate General in Kolkata is committed to supporting LGBTQI communities across the region. Last year, the idea for a transgender health clinic in Kolkata arose out of our Rainbow Talk series, conducted at the Consulate's American Center in Kolkata. And the transgender health clinic called Antor opened at Peerless Hospital in Kolkata on February 27, 2020. It was the first of its kind in Eastern India. The United States is committed to working with like-minded governments and civil society organizations to support and advance the human rights of LGBTQI persons. In February, US President Biden issued a historic memorandum committing the United States to promoting LGBTQI rights on the international stage. The directive states, "It shall be the policy of the United States to pursue an end to violence and discrimination on the basis of sexual orientation, gender identity or expression, or sex characteristics, and to lead by the power of our example in the cause of advancing the human rights of LGBTQI persons around the world." And we are here today in support of that vision. The US government, along with our US Embassy in New Delhi and the US consulates in the region, remain committed to our partners across India and here in particular in the Northeast. Thank you for the opportunity to take part in this important inauguration today, and I wish you all the best. Thank you.
Thank you, Ms. Patti Hoffen, for your presentation and sharing. And now I would like to request Santa Khurai, Secretary, All Manipur Nupi Manbi Association. She is the indigenous Nupi Manbi and trans activist. Please come, Santa Khurai, on the stage for sharing your perspective on this Transgender Health and Wellness Center.
A very good afternoon to all the beautiful peoples around here. And I'm very delighted and happy to be a part of this event. And I have come here with a lot of hopes for the future, for the trans communities in Manipur. And I really thank and pay my gratitude towards ITEC for bringing in the resources for the trans community in the state. However, what I was thinking earlier was that ITEC will give a very good platform and a safe space to the community. Like honestly telling you today, I felt a little bit odd in the beginning because this is a state level inauguration program, and then I was thinking that from the beginning, the community will take the lead, the programs, and people will listen. But my thought was completely opposite when I reached here, when I observed this event, which I think this is also very important. If you really wanted to bring up the community, if you really wanted to uplift the position of the community in every section of the society, in every institution, it is very important you allow the community to speak. but this hasn't happened anyway. Thanks for inviting me. And regarding the health development that Amana and Sati have been doing in Manipur, there was certain development. We have advocated with the Principal Secretary Bhima, and he had allotted a separate quarantine center for the transgender people, which is the first of its kind in the entire country. And along with this, Amana and Sati, we have also advocated with the state hospital and in Janims and other district hospital, including RIMS, there is a separate column for transgender peoples in the OPD ticket where Bonita had invested a huge effort in the advocacy. So there are certain development, but I, as a community person, I would also flag out this as again repeatedly, because if you, madam, you have come from the West and you must be having a very good experience and knowledge about how racism takes place. We are living in the periphery. Manipur is a very small state and people are very closely intact. Whatever doing in another district is known by the peoples in other district. So and on top of this, Manipur is a very volatile and then conflict-ridden state. So when we talk about the minority, I think you also need to think about how to empower the community, giving them the opportunity. Opportunity doesn't mean that you are giving money to them. You are giving only resources to them. You need to give them a position. You also need to understand the position and sentiment of the local community. Anyway, I won't take a long time because I knew that this ITEC is collaborating with Max and Maruloi Foundation. So I was thinking that in the beginning, probably one member from the Maruloi could give the presentation, but I did not know my longtime friend Avina has given the presentation, and it was really fantastic. I appreciate for that. But next time I think this is my humble request. Let people take time, but actually give them the opportunity to come up on the stage and then tell their own narratives from their own mouth. That will be very much more relevant, I think. Thank you so much.
So Shri Alok Saxena is just joining. We are just taking 1 or 2 minutes to get in touch with him. Meanwhile, I'm going to request the implementing partner of this Health and Wellness Center, Ranjit, if you are here. Yeah, Ranjit, can you come on the dais? Ranjit is the president of Marupulai Foundation, also representing the Nupi Manbi community. And she has been a huge support to this entire initiative. And right from the day one, we have always kept Marupulai Foundation on the lead. Please come.
Very good afternoon to all. See, I'm really surprised for calling me here. So in the agenda, there is no mention my name to speak something about this program. So I really appreciate Santa, my friend, for suggesting me to say something from Marupulai Foundations. It might be some agenda that have between the ITEC and Manipur section and NACO. So I thought that this program would be implemented with the support from the CTC and FERFO, and this kind of program is a big program. So there might be lacking behind from the community itself. So I'm so pleased to take opportunity here. I want to say something regarding the Marupulai Foundation initiations. See, I can say proudly, Marupulai Foundation is the oldest community-based organization set up in Manipur. Not only in Manipur, it will be the first time in the North-East, I should say. We have established 25th June 2003 and got registered on the same year, 2003, 3rd November. Since then, we have been working for the welfare of the Nupi Manbi community. Beyond the HIV/AIDS intervention and prevention program, we have done lots of works related for the welfare of the community, like social entitlement, inclusions, the Nupi Manbi's right, and everything and all. So I should say this kind of program, the Transgender Health and Wellness Center will be unique this will be history in India, I should say, because all the Nibiya community could access this unique services that had not happened in the before. So from this onward today, all the transgenders might come to the center and they can easily access the services that have available here in the center. Murule Foundation has been working for the, particularly focusing prevention in HIV/AIDS, but in some cases we have done more and more work on the human rights also. We have been doing collaboration with Sati. Amana is a networking friends, networking NGOs and CBOs. So I should say to the trans community present here, please come to the center if you need any services. When you need, you can access easily the services availability here, like the hormone replacement therapy, laser treatments. In short, if you want to take the feminization procedures, you can take the services from the center. I should appreciate the ITEC team for coming in Manipur, for establishing this kind of work. This kind of work will be history in Manipur, not only in Manipur, India, I should say. So my knowledge in the good is not very good. So I should say in English because so many non-Manipuri people are present here. And also, I would like to welcome and I want to appreciate all the dignitaries come from USA, NACO, Manipur 6, and different sectors, different sections of the government department, like social welfare, Manipur government, hospital like Zenims and Rims, DAPSU officials, and all who present here. I should appreciate a lot from my bottom of the heart. Thank you.
Thank you, Ranjit Singh, my mom, Secretary, Maruploi Foundation. Today, I would like to say something on behalf of the community and on behalf of this transgender health and wellness center. I will take charge of center coordinator of this. Okay. Yeah. And yeah, I will take charge of center coordinator of this transgender health and wellness center, and I feel very proud and I feel very happy to get such a chance to work along with the communities, my lovely friends, my lovely sisters. Now it is very great opportunity, and I would like to thank ITEC, NACO, Manipur State AIDS Control Society, CDC, and the partner organization Maruploi Foundation, and prefer also. I would like to thank all the dignity who present here. And I also thinking that I will be working to make something unique. I will bring out something unique for the welfare and wellness of the overall well-beingness of the transgender community. I will try my best. I will do the best. And with this, I would like to request Roro for facilitating the further programs.
Without further delay, we would like to invite Sri Alok Saxena, Joint Secretary, National AIDS Control Organization, to guide us and express his feelings towards this initiative. It would be very aspiring to hear from him. So please welcome Dr. Alok Saxena on the stage.
Thank you very much. It is indeed a momentous occasion that we are going to have this new Sunshine Clinic in Manipur. So before I begin my formal address, salutations, Honorable MLA and Advisor Health to the Chief Minister of Manipur, Principal Secretary, Health and Family Welfare, Government of Manipur, Consulate General, US Consulate General, Kolkata, Project Director, Manipur State AIDS Control Society, Dr. Melissa, Director, CDC India, Ms. Nandini Kapoor, Senior Program Advisor, UNAIDS, New Delhi, Dr. Anwar Parvez Syed, Mr. Srinivas, and Ms. Abhina from ITech India team, all other dignitaries of and on the dais, friends, ladies and gentlemen. I wish to congratulate all of you on the launch of the Transgender Health and Wellness Center, which is christened as Sunshine Clinic. This will serve as a model for the state, hoping that the learnings from this center can subsequently be scaled up nationally. I'm glad to see what was voiced by the community as their need and what has been envisioned in the National Strategic Plan for HIV and STI 2017 to 24 that is being rolled out today. This was echoed in the TRG meeting of the transgender persons that we held last year. In India, there were an estimated 23.49 lakh, that is 2.35 million people living with HIV, with an adult prevalence of 0.22% in 2019. Children living with HIV comprise 3.4% of the total PLHIV estimates. HIV-infected women continue around 44% of the total estimated 15 plus years PLHIV. There were around 69,000 new HIV infections in 2019, which has declined by 37% since 2010. There were about 58,000 AIDS-related deaths in 2019, which has declined by 66% since 2010. Friends, as we are aware, HIV prevalence among Hijra and transgender is about 3% at national level, as per the HSS 2007. The new round among HRGs has already begun since last month, and we know, and we will get to know the prevalence then and how successful we have been in arresting the epidemic in this group through our combined effort, where all the emphasis is now required to be given. As you're aware, India is revamping its targeted intervention program. Actually, we are in the process. Much of it has been done to focus on hard-to-reach populations. People living in prisons and other closed settings have been considered as priority populations, and interventions have been launched and gradually scaled up since 2017. The HIV counseling and testing services, community-based screening for HIV, improving early diagnosis have been ramped up, including increasing the coverage of testing for HIV across the country to achieve the target of EMTCT, that is elimination of mother-to-child transmission of HIV. We also know that with the enactment of HIV and AIDS Prevention and Control Act 2017, a legal and enabling framework has been provided to safeguard the human rights of infected and affected populations. Under the test and treat policy, approximately 50,000 PLHIV who were lost to follow-up were linked to the ARV treatment through Mission Sampark. Currently, we have 14.68 lakh PLHIV on ART. The program has also introduced simpler, harmonized, and efficacious treatment regimens that will promote retention in care, which remain a global challenge. The policies of differentiated service delivery and multi-month dispensation have been the other significant advancements adopted by NACO. Various models of differentiated service delivery at the antiretroviral therapy centers, multi-month dispensation of ARVs, dispensation of medicines closer to home, and other such models which are aimed at A, decongesting the ART centers, and B, introducing ease of use for the beneficiaries are being piloted and adopted at NACP. Ultimate goal is to enhance patient survival and the quality of life by improving adherence and achieving faster viral load suppression. Viral load testing facilities have also been scaled up from the existing 10, from which was not existing actually, which was earlier 10 public sector labs to 64 labs across the country. Some of these labs were also used as you're aware, for COVID-19 RT-PCR testing. NACO has also started a viral load testing through the public-private partnership model. These two, that's the PPP model and our own in-house labs, together should be able to take care of our need for universal viral load testing. In this, we know that prevention, though of course treatment is prevention, and when we talk about U is equal to U, it is important that of the people living with HIV, everyone should get treatment and everyone should adhere, and the viral load should be suppressed to the extent that it is negligible, and thereby we achieve U is equal to U. But in this race for increasing number of tests, putting everyone on treatment, this remains, I'm not saying even for a moment that this is not important, this remains a major work, and adherence and viral load suppression. We should not lose focus on prevention among key population, and we should not lose focus from the communities. That is very important. The drivers, or rather the driver of this epidemic in India is still the sexual route. So our key population groups, which are vulnerable, which are most at risk, need to be completely taken care of. The focus should not be removed from them. So there, our most visible community, the KPs, are transgenders and hijras. Transgenders particularly, a lot of work has been done. It started with NACO and National AIDS Control Program, but now, as I discussed with all our TG colleagues and partners, that their natural habitat is now the Ministry of Social Justice and Empowerment. An act has been enacted by that ministry. A whole lot of social protection programs and activities are being rolled out by that department. Our endeavor in Ministry of Health and NACO will always remain to connect all our transgender colleagues to be linked with these facilities and services that Ministry of Social Justice and Empowerment has created and is creating for them. But that does not mean that the role of Health Ministry and NACO will diminish in any manner. The COVID pandemic, COVID-19 pandemic has also showed that what an importance mental health is, what is the important role of counseling, hand-holding, talking to each other. So there, it is important that the mental health issues of all the key populations need to be taken care of, but particularly in the case of TGs, their health needs and requirements will continue to be catered by Ministry of Health. Now this starts with a young child feeling trapped in a non-familiar physical body. That child's need to talk to somebody. So that need we need to take care of. Then answering the questions, showing them what is doable and how it is doable. Maybe creating role models for them. It is tall order, but we need to do that. Even in our community in last 25, 30 years, we have tall personalities who could be, and in the age of social media, who could be role models for these people. So there is this need for mental health counseling, handholding. Then if what is required is gender reassignment procedures, ethical, legal ways of doing that, having clinics where these services are given to them. Then, of course, from HIV, AIDS, and STIs, prevention, treatment, the entire area of services, testing, and community building that kinship amongst community. So that remains our goal, and that remains the focus even in the new phase of NACP that starts from next week, and the new round of Global Fund funding cycle that starts from 1st. So next week, 1st of April, is going to be a momentous day when the next cycle of Global Fund funding cycle starts and the next phase of NACP starts. We have plans, a very focused plan for having more such clinics. So it is against this backdrop that the importance of this clinic and other such clinics which are being set up by other partners in various parts of India, the importance is that they give us models. They give us scalable, sustainable models, which then can be subsequently rolled out all over the country at health locations, or these could be at locations other than health facilities. Because there would be a reluctance among these people to initially walk into a healthcare setting. So more a counseling kind of a thing. And I see in this direction, when I was briefed by Srinivas, he told me that there are these two setups. One is the medical setup, other is more a social interactive setup. So that is what is required. Insofar as health is concerned, Ministry of Health and NACO will not be found wanting. We will also be helping in linking with the other facilities that Ministry of Social Justice and Empowerment and other partners are creating. But the idea is that we take care of the health, we take care of mental health, physical health, their needs, and also the sexual health of these people, keeping them safe, keeping them healthy, and these people living, all our people, leading long, healthy lives. That is the goal. They should remain happy. And in that, our role as communities and societies comes into picture, where we need to be, working together hand in hand. I think it is in this direction that this Sunshine Clinic, this Health and Wellness Center, is very important. We will be watching from New Delhi its progress and how it develops, because it is our interest, it is in our interest that it develops, it grows, and it proves to be a model which is worth emulating, which is worth replicating. Thank you very much. All my best wishes to you. And it's my promise that as soon as the pandemic subsides, we shall be visiting. Actually, my team, Dr. Goel and Dr. Shobni, was saying that it is a huge loss to us that we were not there. We are not there today. But at first given opportunity, some of us will be visiting. And all the best. Thank you.
Thank you so much, Sri Alok Saxena, for sharing your distinct vision and ideas. Now we'd like to request our distinguished chief guest, a well-known doctor with huge compassion and commitment, Dr. Sapam Ranjan Singh, to come up on the dais and inspire and motivate everyone towards fulfilling the dreams and aspirations of the transgender community of Manipur and the entire Northeast. So please welcome Sir with a huge round of applause.
Sri Vumlung Mang, the Principal Secretary, Health and Family Welfare, Government of Manipur, and President of the Manipur State AIDS Control Society, who was with us, but he had to leave because some important official commitment with the financial year ending. Sri Alok Saxena, the Joint Secretary, NACO, Ministry of Health and Family Welfare, Government of India. Ms. Patty Hoffman, Consul General, U.S. Consulate General, Kolkata. Dr. Shobini Rajan, DDG NACO. Dr. Melissa Nyandak, Director, CDC India. Rosita Haubam, the Project Director, MAX. Director of JENIMS, Dr. Bhimo, the Superintendent of JENIMS. Dr. Lokeshwar, the transgender community, friends from the media, ladies and gentlemen. I would rather express my gratitude and privilege to be here on this opening, the launching of the Transgender Health and Wellness Center, Manipur, and I'm told it's the first time in India that a transgender health and wellness center has been launched. And I think, and I feel it is true, that the importance of this wellness center, and the importance that the government takes for this community, this special community, it's shown by the host of dignitaries that we have today, who have come from outside, and also, I think the presence of Consul General, US Consulate General Kolkata, and Dr. Melissa Nyandek. I think this shows the importance of this event. And rightly so, this Health and Wellness Center, it is very important. I would also like to congratulate NACO, MAX, CDC, ITAKE, for taking up this initiative, an initiative which has been taken at the right time and has been taken in the right spirit. We all know the challenges faced by the trans community, whether in terms of the health, whether in terms of their wellness, or in terms of the human rights that every one of us should have. It is important that we all get the equal rights in all aspects. I know the transgender men and women are marginalized and face acute stigma and discrimination. And we all know that access to health, which is so important, due to the structural barriers that the transgenders face, there has been healthcare discrimination. And not only in the health sector, there has also been violence. And we all know that there is lack of family support. But as a doctor and also as a person with the health department, as an individual, it's not only the people who are here, the trans who are here, functions you have to rise above them. Let not all those stigma, let not all those, looking at you towards a negative way. Don't let that be a deterrent. Aduna ishana tawning ba thabak. Whatever you want to do, don't let that be a barrier towards that. Because we know there are many things special in all of you all. It's God's will. It is God's will. Whether we are born as a man or whether as a female or whether we are trans. And the acceptability by the society and the acceptability by the government has been increasing and it is increasing by the day. We should not let, I again reiterate, we should not let any of the stigma that you face and all the discrimination that you face be a deterrent, be a barrier to whatever you want to do. In Manipur especially, one of the very examples that you are accepted is the example, wherever, let me just put my words in both the languages so that, Manipur da, ako'y hosik luhong ba, when we go for marriages, the beauty parlors, polo shetpa, even for tailoring for, the clothes that we wear, people call all of you all. for the men as well as for the female, the trans are being called, to get themselves beautified, because that is, I think, one of the quality that you have, that you can, make people look better. Natrane, poloi setpa huzikandi yamna chatnare. Be proud of that. Duga P tuba, and even trans men huzik there yamna karina security personnel dozo yamna yaure. Natra, ayamba security personnel, even akoi auto gathoraga, things which was once thought to be a people who are nupa khakta na keno tokta ngambai mo do, now the trans keno zo dum loina keno taunare basise. Season attack, that shows the acceptance by the society. Aduna ina appeal to all of you, please be brave, be proud of who you are. Manipur, the famous personality, it's not only in Manipur, Pitri with the Yamone. There are famous personalities who are trans. Nasai kenona haibi gibedo, as our Consul General just mentioned, the LGBTQ rights kado. They take it so seriously. And those rights, Manipur dozo, for our country, India, the rights are increasing. It is so important. It is, I don't know whether seriously, these are things which are speaking from my heart. Be brave. I have friends who are trans. I know many people. I mix around with them. We talk to them. For the trans community, what I want to appeal is just don't mix around with people. Talk to them. Talk to them what you're good at. Talk to them the problems that you face. See, how would you know? How would we know the problems that you face? There are many things. Family the hiding the just don't discuss within the trans. Talk to people who are, the male or the female. Talk to what is it really? Talk to unless you tell your stories, you tell your words, others will not know. And I think that interaction is so much important. I interact with a lot of people who are trans. Example, being a public representative, I always ask my people, how are they doing? People, the trans community, they come to meet me very often. And I ask them about their problem, about the health issues. Take care of your health. I speak to them a lot. And this is important. And we have to all grow. Don't think that I'm trans this, I'm trans. Don't. We are equal. We are all same. The government, health sector, I know there will be lots of communication gap between the healthcare providers and the trans. That communication gap. Adubu hoziki health and wellness na amu hinazo hoziki case di yang hemu hinazo pagalarni suksoi soidana duga ekoi asai ina hajabado amuka awareness. We need to create an awareness. Duga koi violence handanaba, stigma laitanaba, discrimination laitanaba, mental health. It's today. It's one thing which I really felt nice in this August gathering. We had a lot of psychiatrists. We have few psychiatrists here, and I think it's a right platform for the psychiatrists to be here, and they are the ones who are going to help you out and deal with all the stress. We know how much stress you are dealing with. I don't know, stress me amdo. Psychiatrists are already consult psychiatrists, psychologists, tanabiu, because they are the ones. It's the stress. Trans everyone is under stress. Because psychiatrists has a role, it's over miyawi and family support. I believe community-led estimate of the 2,530 transgender people in Manipur. But I think this would be more. I think this should be more, and not just 2,530, it would be more. But I'm sorry to say that I did try to find out about the number of transgender in the electoral roll. Kayamul leram ge khangba electoral roll sida Manipur gi oina. I just got the record yesterday because I was so much concerned how are things moving ahead. Suknatagi 94 khak leram meba. Registered they opened up just 94 of them opened up that yes, I'm a transgender. That's 94. I think this should increase also. I think but reality though, so that the government also can plan out. It has to be data driven. Data is a I cannot just say that, oh, sige can was the me that there'll be 50 or 50 lamb. If it's 150, how can the management of the health and wellness center work? Only when you have the data, the number of people who are trans, only then you can plan out how the health and wellness center has to work. So that proper data has to be what I feel is, I think it's important that we have that proper data and the accurate data so that people come up and then and while I was just reading that, I believe in this health and wellness center, lots of vocational courses also will be there. And I'm sure with the presence of director of Jenims and the superintendent of Jenims, they would be taking extra care that this health and wellness center with a very appropriate name that has been given, Sunshine Health and Wellness Center, this should prove to be a boon for all the trans community and be a sunshine for all of you who are present here from the trans community. And the rights and everything, I think they've taken, it's been taken in a very serious manner. And someone just mentioned in the electoral process in the next election that there should be some transgender. And who knows, one day, because the acceptance by the society is coming. It is coming. We cannot just lie down. It is coming. And I'm sure we've been told that there's opening, that there is separate OPD counter, Jenims, Rim Sazuk, Taulere, Akoyadum, trans, Kidamakta Tunganba, OPD counters hange. But what worries me at the end, as per the reports of the UN AIDS, which was just told, 19% Chada Taraga Mapan trans women's HIV positive OEHs. HIV positive OEH. We need to be careful. 19%, it's very high. We need to take care. Duga kenugis the nakogi kenugis 7.5 high, and the government has been proactive, I should say, in seeing about the welfare of the trans community de magta kari torige kamaina torige mogi healthcare aduna bo handakta akoigi COVID during the worst time of COVID. I'm using the word worst time because we still are reeling under COVID, and we had a separate tunganba trans singi tunganba corona quarantine center ama hangbiduna adum yam phasana adum tawbigi beduni aduna. It's important that we all are brave, we all become successful in whatever we do. Whether trans men zing na tawba ngamba number thaba khuding trans women zing na tawba ngamba thuma, you can in a very graceful way, with pride in what you are, with pride in what God has given to us, and with a spirit that yes, we can. And that spirit should remain in all of you. And I'm sure that this community can, is and will be one of the, a community that brings our state and our country forward. Thank you so much. Thank you so much for inviting me here once again. Thank you.
Thank you, our chief guest,
Dr. Sapam Ranjan Singh, Honorable MLA and Advisor to Chief Minister Manipur, for your gracious presence here and valuable speech, and for the motivating the community, and for moreover for the acknowledging our transgender communities of Manipur. Thank you a lot, Dr. Sapam Ranjan. And next, here, I would like to state something that this program is supposed to be facilitated from the beginning by our trans sisters, but I myself was not able to attend here timely because I was stuck at the traffic. So I would like to apologize to all the dignitaries, my community peoples, and ladies and gentlemen to pardon us for not coming on time. So next, I would like to request one of among the most important trans ally of the state. He is none other than our father, like Sir Abhiram Mongjam, Joint Director, Manipur State AIDS Control Society, for the kind deliberation of vote of thanks. Please, sir, come up on the stage for deliberation of vote of thanks.
Good evening. Now the time has come to say vote of thanks. Really, today is an amazing day. All of us, we thought about our trans community quite long since the big epidemic come to Manipur. When the epidemic comes to Manipur, it was, at first, we saw it among the IDUs. But when the epidemic keeps on continuing, but suddenly we saw this epidemic among the various groups of people. But at the time, NACO is identifying only one group called MSM. So MSM community was also identified as one of the typology where HIV has been spreading in the state of Manipur. And that was first time that this program was implemented through SASO, where the first sentinel surveillance was done. And amazingly, that among the MSM population, it was 29%. And it was really a surprise to all of us. Since then, we have been trying to implement the HIV prevention program among the trans community, particularly MSM and TG population. So now, with the implementation of the National AIDS Control Program and with the support of our other partners, we have been implementing this program, and now it has come down up to 8%, but still it is very high percentage among the MSM community in India. So today, what we have foresee the launching of Transgender Health and Wellness Center. This will definitely bring a change in HIV epidemic in Manipur, as well as to bring a very good sign among the trans community where their rights has been not well taken by the society as well as by the family. So today, in this important launching ceremony of the Transgender Health and Wellness Center, I want to thank Dr. Sapam Ranjan Singh, Honorable MLA and Advisor, Health to Chief Minister Manipur, for his valuable time and for his valuable speech, particularly addressing to the community from the core of his heart, and also the commitment shown by this government towards this community. I thank once again today's chief guest, Dr. Sapam Ranjan Singh, and also I want to thank Sir B. Bumlung Mang, who is the Principal Secretary, Health and Family Welfare, Government of Manipur, and also the President of Manipur State AIDS Control Society, who has been helping and guiding Manipur State AIDS Control Society in many fronts. And today also, he has been joined with us and also help us in guiding this program to the itself also. And also I want to thank Mrs. Patty Hoffman, Consul General, US Consulate General, Kolkata, for her valuable time and physically coming down to Manipur and interacting with our community people and also helping this program a grand success. And also I want to thank Dr. Shobini Rajan, who attended this program virtually. And also I want to thank Sir Alok Saxena, though he was a bit late, but he managed to attend the program virtually from Delhi office. And I want to thank Dr. Melisha, Director of CDC, India, for her restless activities. She has been in Manipur quite long time, since 2018 onwards. She used to visit Manipur and try to fill up those gaps where we have been facing in Manipur, and CDC is kind enough to extend the possible help in Manipur, not only in the front of prevention, but also care, support and treatment also. And also I want to thank the ITEC team. The whole team came down here and has been helping today's program a grand success. And also I want to thank the other invitees, the other colleagues from Sathi, Amanna and Bihan, who has been here in Manipur for helping our community in various ways. And also I want to thank all my colleagues from Manipur State AIDS Control Society and NHU. And also I want to thank Dr. Bhimo and the whole team from Jenims. Actually, without the support from Jenims, without the commitment from Jenims, it could not be a grand success. Now, also, our Chief Guest has rightly pointed out the needs of the secretaries today. They have shown their commitment towards this. And also, I want to thank the head of department of secretary and her team who has been in this program, and we do hope that various activities in future, they will continue to support us. And also I want to thank the cultural team who have, in the beginning, they have shown their performance, cultural performance, and for that, I want to thank all of them. And also in the next program, which is coming, cultural performance by the community team, I think they will continue after this program also. And once again, I want to thank all the invitees, all my colleagues from the other districts who has been participating in this program. And thank you all.
A small announcement for all of you, like the formal function has ended. We will be pursuing towards JNIMS, the Help Desk Center for inauguration, as well as in the Health and Wellness Clinic for inauguration. But I would like to request all the invitees to please stay on, because we have still 2 more programs to continue. That is the cultural performance and community interactions will be there, and followed by a dinner. So all are requested to please stay till the end of our program for today. Thank you so much.
Thank you, Dr. Lucy. While the distinguished guests take a round to the Transgender Health and Wellness Center and Jenims Parampath Help Desk and comes back to Classic Grande, we would request the community representatives and community leaders from the transgender community to stay back and celebrate this auspicious movement with cultural program and dinner. Please provide, and we'll request the community to come and take the lead now here. Community community representatives from Manipur, please come and take the lead for the cultural program here. Thank you.
Hello. Now, please concentrate. Everyone, please concentrate. Now, the cultural program and community performance and community interaction is, and here Heramoti, one of the best artists in one of the most important festival of Manipur, Sumang Lila, the courtyard play. She is not only an artist but also a prominent dancer of Manipur. Now she perform a Samoda Damoda dance, like the Dasha Avatar. The Samoda Damoda is a dance from which is adapted from Geet Govinda, composed by Jayadeva. This particular dance depicts the love between Lord Krishna and Chandrabali. The Tanchav Tala is main rhythm employed in the dance, one of the highly acclaimed dance form in Manipur dance. The Samoda Damoda is famous for its delicate body movement, execute hand gesture and dynamic rhythm pattern. Now please come over the stage, Heramoti.
Chandana Chorchitani
अखोई हजिक प्रोग्राम लोइजब नते अखोई जेनिम्सता रिबन कक्पा चसगिबे वा खक्तनी अमु हलखिनी अदुना हजिक अखोई कम्युनिटी गोबा अखोई प्रोग्राम सिदा मयाम पुनिंग चंगना अमतंग यंगमिनसी मियंग तामिनसी अदो हजिक ओइना अखोई ट्रांस मेन ओइना अखोई इसै दा अदुम सक्चबा इसै थवा याउजबा हाइतारेको अखोई जॉर्ज आत्मा इजु एग्जीक्यूटिव मेंबर मोइन लेजरिबा जॉर्ज स्टेज दा अखत पिरो दुगे इसै संगना बाहायना निंसिंजरी
family lure hang lava ardiyara yen khadlu badanangi shatam hang la ardiyara nangi shatam tankare lava atiyasu nangi sakam thankare Sukham sidi nahakam adukari wahali Asukham sidi nahakam aibukari wahali Laglo pamu vinung sibi Kolage ng bunga sidi Laglo pamu vinung sibi Kolage ng bunga sidi Aigi handaba abung sida Aibu nungsiba tambiriba Luntok traba sa tambi Mahati Nuntiba Minok na Panaw na hali Aibu Ofang kanda Aibu nungsiba tambiriba Luntok traba sa tambi Nuntiba Minok na Panaw na hali Thank you.
Welcome back again, everyone. Let's get set ready for our excitement and delight. Save of your energy, everyone, because now we are going to catch sight of some great dances from our nominating personality over here in Imphal. She is the first Miss International Queen of India who represents India in Thailand. She is a Sumangla performer, an actress, a right activist, and a well-known fashion designer. Please welcome Mrs. Hurem. Please give a big round of applause for Vicious Hurem. She's going to perform Krishna Thamogi Krishna as a tribute to our noted actress who just expires few years back, Sima. A tribute to Manipuri actress Sima. She is going to perform Krishna Thamogi Krishna. So please welcome Mrs. Hurem with a big round of applause once again.
Ubiro aibu thamu ilai kolda chutla rone nahi aigi laikada chutla rone nahi aigi laikada injara ke na tum khoje Krishna, Krishna, Thamogi Krishna, Krishna, Thamogi Krishna, Krishna, Thamogi Krishna. Radha, ay thamoy Radha. Nangina kong tabala, kasi rin pusisi, langaw-langaw ko din da. Tahan binu punsise, manglagi punsiku. La 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 la. Tahan binu nay maida, joy jay na bilay rangku. La 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 la. Tahan binu punsise, manglagi punsiku. Tahan binu nay maida, joy jay na bilay rangku. Oi 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 oi. Krishna, Thamogi Krishna, Krishna, Thamogi Krishna, Krishna, Thamogi Krishna, Krishna, Thamogi Krishna. La 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 la. Bin biyune na hagna, ay hagi sa tikta. La la.
Good evening again, once again. I will speak in Manipuri because most of my community members will comfortable with this language now. So, hꯧꯖꯤꯛꯁꯦ community interaction program ꯑꯃꯈꯛ ꯊꯝꯃꯦꯕꯀꯣ ꯀꯅꯥ ꯑꯗꯨꯅ interaction program ꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯉꯁꯤ ꯂꯤꯡꯈꯠꯂꯤꯕ transgender health and wellness center 하이드나 링크리버세 시다 करी सर्विस फंगनी अदुगा कम्युनिटी की एक्सपेक्टेशन ना करी नो अखोइना जो फीडबैक खरदी लौजो होगे बको अदुगा अखोइना तौजरिबा सर्विसिंग से अखोइ एकदम हाइजरके अखोइगी हेल्थ एंड वेलनेस सेंटर हाइसे मणिपुर स्टेट एज कंसोल सोसाइटी का कुसमनरगा मरुबलोय फाउंडेशन मणिपुर द इम्प्लीमेंटेशन तौबनी सिगी ऑफिस से ngasi संगाबनी ऑफिस तो पोरमपाट की जेनिम्स की अपोजिट ओइ कई तौरगा खितंग हाइगलागा सोमना कंदा खितंग हाइगलागा सीएमओ ऑफिस चीफ मेडिकल ऑफिसर इम्फाल इसकी ऑफिस की एक अपोजिट ता अखोइगी साइन बोर्ड थेलगा दुम लेरबनी मयाम लोइ उबिनिको अदुना मयामना एनी प्रॉब्लम लेबा मतमदा अखोइगी सेंटर दा लाकपियु अखोइगी सेंटर दा फंगिबा फैसिलिटी सिंगसे अखोइगी पुकनिंग वाखलगी हारगा हेल्थ हारगा अखोइना हेक हौरकपदगी हौना हेल्थ हारगा ट्रांसजेंडर की हेल्थ इशू मयाम अम लेग्रेको डिफरेंट हेल्थ इशू नॉट ओनली एचआईवी खतंग नतबा अदुबो अखोइ एचआईवी सु काक्तोकपा यादे अदुगा दिस इज वन ऑफ फैक्टर नेबा अखोइगी हेल्थ समटाइम्स एंड along with that अखोइ मेंटल हेल्थ इशू अखोइगी पुकनिंग वाखल की पिबम फलक्तबा मतम अखोइगी वाखल नुंगाइरक्तबा वाखल पोथाबं खंगदबा सुसाइडल टेंडेंसी सिनिंग फारकपा मतम अहिंग तुंबा यारक्तबा एंजाइटी लेरक्पा अदुगा मयाम से अखोइना खंगगसु कराइदा चलगा लायेंगदोइनो कनागा तानादोइनो हाइबा पोसे अखोइ कइगुम मतमदा खंदरुदि अदुना मरम ओइरकांदा अखोइदा लॉन्ग टर्म की ओइबर डिप्रेशन लेरक्पदुना लास्टदा साइको की प्रॉब्लम लाकपा थबकता पुकनिंग चंगक्तबा सेंदाल लंबीदा पुकनिंग चंगक्तबा इकोनॉमिक लाइन दा सोंदरक्पा अदुना मरम ओइरका सोशियली तपना एक्सक्लूजन ओइरक्पा समाजदगी नाथैरक्पा समाज की चटनबी की वांगमदा थबक तौरक्पना सिंगबा मखल की थबक थौरम मयाम मा अखोइगी मिबांग ngasisu uduna dum leire aduga ट्रांसजेंडर की एक्जिस्टेंस है कांदा अखोई ngasi sida puliba kaktang chunate अखोई लाइबा मयाम से याम हराउजै सिदा लेइबा मयाम सिना लेकाई लेकाई दा आइका खंगना इमानबी सिंगदासु पाउ पिबियु अदुगा मरु ओइना आइगी नुंसिजरबा ट्रांसमेन इसिन नाउ सिंग अखोई खरा लाकपिबा से ngasi di yam nungai re aduga ट्रांसमेन की इशू से मतम पुना मक ट्रांसजेंडर हाइनागा ट्रांसजेंडर वुमेन खक्तदा फोकस तौरगा लेइबा जे सिगुम्बा से सी वांग मदा अखोइना thugairакꯥꯟꯗ trans men su sang nupa manba hairaga khangnani ba kangrop sisu konjalaga thabak tawribasi nupa manba sing sikisu oiba health related oiba issue mayam ama lerangani adu so koi wari saminaji akoi gi leriba center dagi service lawminaji aduga apam pam da phongdokpagi tanja do mafam matang sida lawhoraga somgi aningba somna center sitangi phangani na khanba center sina kana center sina pigani na khanba kana basing do thaminasi adugi tanja do lawjagi aduga any community member amta lakpiyo ama kaktang mari mari adum tawse kana amta lakpiyo da prem se prem please kaigum khara haibiyo centers diga mari leina akoina tawdori ba thabak se aina hojik samlapa haire dana ko sigi matang sida se prem gi wakhanda kari leige sidagi phangba ya ba kana ba ya ba se community da kam yam kana ba pi gane na khange community da kana ba pi na bohana ba da akoina kari kari tawgadage haibado akoi center da leidori ba akoi staff sing se si sing sina community gi damakta kari kari tawjauge haibana singbado haipeta thambiyo ba please enlighten us. What should we do for the community, for the welfare of the community? What the community is wishing to get from this center like that? Expectation. Ay adum hayo yari. Adudi lakpiro. Ako isininaw singi manaktagi ama thokpiro sopin or siyare is kana yamati lo tama or siyare lakpiro. Kaigum khara share tawbiyo lao. He is great among us.
Thank you everyone. Akoigi transgender haireko. Transgender da akoigi trans men gi oina issue khara di akoi thengnaba problem hairgadi. First ta akoina thengnai je family dagi yadaba. Family yadrabanina mapan thokpa ngamdre. Mapan thokpa ngamde mapan thokma tamda so ima ipana nang nupini ne kaina ga chaiba social haidi family dagi stigma phangba yam sa yam telam ten ten dum haijage adi matungda hojiki dumai phange khalo mana chahi manga tara nupi na laja tar so kona mana ngam pamatam dadi family the challenge laga family ka nushina da potse badum laib adagi aigi thengrapa experience hargana experience hana khara share tawjage aigi friend ani society tawgi amana mapana phubadagi adagi amana magi tinaba mamana bido adagi ama society tawgi ani moi ani mo society tawgi even ai makta hairo ai bokta dum family ga imai pana yatar so haidi nupa nupi leina banina itinau da nupa yawi nupi yawi adida moije nupa da hena focus piba khodi nupa man ba nupa sa lai banina hekta discriminate openly tawda tar so mentally kokta dum akhoida harassment piba haitara adumagna imai panu sida ha ngata imai panu sitar so moi makta lai ning deba tasengna khoi community gi makta lai ba yam pameba sina khoigi smai khar leire aduga akhoigi trans sida khoina pambaje sum family dagi saunara thorpa matamda short stay home gumba leiba pameba matam khra gi oina short stay home leiba pame duga plus akhoigi leire dana yam kuina sang leibadi apote matam khra mangai magi thabak kadai da surani kadai nomgani haidi akhoidi suro nommaga chaga do ngaktani na akhoigi thabak pigada jaga haitara khoina tawba ngamba sumba su phar pame aduga khoina smai si male matung de khoina pami je kino je pam hormone therapy gumba tawta di hena transgender manung de lai jingje akhoida su tumin privately message tharpa Facebook Instagram ma'am message tharpa yawi singo ma'am su dum tumin come out tor kadra khaleba sim lai jare du mathakta khoina mo pamadi ma'am lai gre duga hena khoi je hanurakta badi yadeba hanuruk matamda akoigi hengko leibam haibam leiriba paisa paiba nungaiba na kharana magi masak maran yam leiba kangbu khana dum nungai gini wana leiba kangbu di kadai cha leiruni even maringo masna kolam da chu yam lei mathanda yum hingon achau na mathanda leiba adugum bagi na transmen gi oina ꯍꯥꯏꯗꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯒꯤ ꯑꯣꯏꯔꯁꯨ ꯇ꯭ꯔꯥꯟꯁꯃꯦꯟꯒꯤ ꯑꯣꯏꯇꯥꯔꯁꯨ ꯍꯣꯝ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯨꯒꯨꯝꯕꯁꯨ ꯄꯥꯝꯃꯤ ꯄꯥꯝꯕꯗꯤ ꯃꯌꯥꯝ ꯂꯩꯈ꯭ꯔꯦ ꯑꯗꯣ ꯃꯌꯥꯝꯁꯨ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯥꯟꯁꯃꯦꯟ ꯃꯌꯥꯝ ꯃꯔꯛꯇꯒꯤ ꯏꯁꯥꯅ ꯊꯦꯡꯅꯕ ꯑꯦꯛꯁꯄꯤꯔꯤꯌꯦꯟꯁ ꯑꯗꯩ ꯇ꯭ꯔꯥꯟꯁꯃꯦꯟ ꯃꯌꯥꯝꯗꯒꯤꯁꯨ ꯏꯁꯥꯅ ꯊꯦꯡꯅꯕ ꯑꯦꯛꯁꯄꯤꯔꯤꯌꯦꯟꯁ ꯃꯌꯥꯝ ꯑꯃ ꯁꯤꯌꯔ ꯇꯧꯕꯤꯌꯨ ꯁꯤꯅ ꯑꯩꯒꯤ ꯈꯔ ꯈꯛꯇꯅꯤ ꯆꯥꯎꯔꯥꯛꯄ ꯊꯝꯖꯔꯤꯕꯁꯦ ꯑꯗꯨ ꯃꯌꯥꯝꯁꯨ ꯂꯥꯛꯑꯒ ꯁꯤꯗꯩꯗ ꯏꯁꯥꯗ ꯑꯄꯥꯝꯕ ꯃꯌꯥꯝ ꯂꯩꯗꯣ ꯑꯩꯅ ꯂꯣꯏꯅꯃꯛꯁꯨ ꯍꯥꯏꯕ ꯂꯣꯏꯕ ꯅꯥꯏꯕ ꯅꯠꯇꯦ ꯃꯌꯥꯝ ꯂꯩ ꯃꯌꯥꯝꯁꯤꯅꯁꯨ ꯑꯗꯨꯝ ꯁꯤꯗ ꯀꯥꯈꯠꯄꯤꯔꯒ ꯑꯄꯥꯝꯕ ꯃꯌꯥꯝꯗꯣ ꯏꯀꯥꯏꯕ ꯍꯪꯒꯣꯏꯕ ꯑꯗꯒꯤ ꯃꯌꯥꯝꯗꯣ ꯊꯥꯗꯣꯛꯄꯤꯔꯒ ꯇꯨꯡꯗ ꯊꯥꯗꯣꯛꯄꯤꯔꯒ ꯍꯌꯦꯡ ꯀꯣꯟꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯨꯡꯗ ꯍꯧꯔꯛꯀꯗꯧꯔꯤꯕ ꯐ꯭ꯌꯨꯆꯔ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯥꯟꯁ ꯀꯥꯡꯕꯨꯒꯤꯗꯃꯛꯇ ꯀꯩꯗꯧꯕ ꯌꯥꯒꯦ ꯍꯥꯏꯕꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯍꯧꯖꯤꯛꯇꯤ ꯑꯋꯥꯕ ꯊꯦꯡꯅꯔꯤ ꯃꯌꯥꯝꯁꯦ ꯃꯣꯏꯗꯗꯤ ꯊꯦꯡꯅꯗꯅꯕ ꯃꯣꯏꯒꯤ ꯂꯝꯕꯤꯁꯦ ꯅꯨꯡꯉꯥꯏꯅ ꯆꯠꯆꯅꯕ ꯁꯤꯒꯤ ꯄꯣꯠꯁꯦ ꯁꯤꯁꯨ ꯄꯥꯝꯃꯦꯕ ꯑꯗꯒꯤ ꯏꯚꯟ ꯑꯩꯈꯣꯏꯅ ꯂꯝꯕꯤ ꯂꯝꯈꯥꯡ ꯆꯠ ꯇꯥꯔꯁꯨ ꯆꯦꯛ ꯇꯧꯕ ꯆꯦꯛꯀꯤꯡ ꯁꯤ ꯌꯥꯝꯅ ꯗꯔꯀꯥꯔ ꯂꯩ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯗꯤ ꯃꯌꯥꯝꯅ ꯑꯗꯨꯝ ꯁ꯭ꯇꯦꯛ ꯍꯣꯜꯗꯔꯗ ꯂꯩꯔꯤ ꯃꯌꯥꯝꯅꯁꯨ ꯑꯗꯨꯝ ꯀꯩꯅꯣ ꯇꯧꯕꯤꯔꯛꯀꯦꯅ ꯈꯜꯂꯦ ꯃꯇꯦꯡꯗꯣ ꯃꯇꯝ ꯃꯇꯝꯒꯤ ꯑꯗꯨꯝ ꯂꯥꯛꯀꯅꯤꯅ ꯈꯜꯂꯦ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯒꯤꯅ ꯍꯣꯝ ꯗꯤꯄꯥꯔꯠꯃꯦꯟꯇꯒꯨꯝꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯒꯤ ꯑꯣꯏꯅꯀꯣ ꯍꯥꯏꯗꯤ ꯈꯔ ꯔꯤꯖꯥꯔꯕꯦꯁꯟ ꯊꯝꯕꯅꯤ ꯈꯪꯗꯦ ꯁꯨꯝꯕ ꯃꯌꯥꯝꯁꯨ ꯇꯧꯍꯟꯅꯤꯡꯉꯦ ꯑꯗꯒꯤ ꯏꯚꯟ ꯗꯣꯛꯇꯔꯒꯤ ꯑꯩꯈꯣꯏ ꯍꯦꯜꯊꯀꯤ ꯃꯇꯥꯡꯗꯁꯨ ꯉꯁꯤ ꯏꯅꯣꯒ꯭ꯔꯦꯠ ꯇꯧꯔꯦ ꯌꯥꯝꯅ ꯍꯔꯥꯎꯖꯩ ꯌꯥꯝ ꯊꯥꯒꯠꯆꯔꯤ ꯃꯇꯨꯡꯗꯁꯨ ꯑꯩꯈꯣꯏꯒꯤ ꯇ꯭ꯔꯥꯟꯁ ꯀꯥꯡꯕꯨꯒꯤꯗꯃꯛꯇ ꯃꯌꯥꯝ ꯑꯃ ꯇꯧꯔꯛꯀꯅꯤ ꯍꯥꯏꯅꯁꯨ ꯑꯩꯅ ꯑꯁꯥ ꯇꯧꯖꯔꯤ ꯁꯤꯌꯥꯔ ꯂꯣꯏꯁꯤꯟꯖꯔꯒꯦ ꯊꯦꯡꯛ ꯌꯨ
Thank you so much, Mr. Safin. He narrated that he wants to have a short stay home because he got most of the time neglected from his family. So when he fights with his family, so he wants to, install a short stay home and have job employment in government and private sectors and HRT in accessible price and to introduce a special clinic where he can get HRT in proper way. So this is the, in our center you can accessible all these things, but short stay home is not implemented yet, so we have to wait for the better day. So next I would like to call a brother from our trans community, so he wants to narrate something.
Thank you very much. I khonjenjiga isaksiga yam chanadam ado aigi thamoida laiba akoi transing na thengnariba awabasingi matangda ai kaiguma khara ningsingjage hojik manipur da world dagi india dagi manipur da transing je masa khangbirak pase masa ai tasaina thawai hakchang yauna ai yam harawi adubu aina ahanbada thamjaningi bo afamdi ai kanano aikhoi kadai dagi lakpano haibase akoi isa na hojikti loi khange aduga akoi khangbagi mathakta public na moise karamba meno kai dai horone masakti yam oi moise moigi group mayam group mayam di lei moise kamai tawa mino haibase ngasi mak khoigi public na khoije khangbirakpa nungsirakpa mase tasena khoi laibak phabani matang jida ina thamjaninge bo afamdi akhoi ubada daw yaroi moigi hopeless orne ado hojikti as moigumba ma pom ta deba mama ampa je yam marai ba phabu mama ampa oire haine masigi praman ai pijage masanu pa na mamaugi oigrani masanu pi na mayagi oigrani mama mapa duna sola matamde yengbina ba kana muk leite taseng na akhoi ima ipa sanga leijaba akhoi ima moigi aseng balal la do akhoi oiba akhoi di trans loi na mani ko transmen loiro transmel loiro taseng na mama ngai da oja ma khale me mai ai sa je aduni adani macha je am ti hulle ada mapa je na suddenly nara kan je mapa je hospitalized to bina kan amu leitre ga na ngasagi mai macha transmen do man thi ngangi ni ko adu duna doctor da pukhat pire kana mapa je na penbi mandana magi ATM ka to ngasai transmen dra sinare ba ko as aina di sa je yamna mina ngangbada natana ai napa aina bong yam ngangubado ngasidi ipa pele se ipagi ereba paisa nungsa nang loi oiro na mapasina sinageba ada leikaisina mu hainare as aigi isa no pa yung ba taramo pok tok surune asugumba mina noknari ba homo ni ka haise asumbam pok na khwaidena laiba phare na khanare matam amada akhoi father se ai wari matem tang lijage asumi atai leiraga so dum kaino tobyo akhoi dada mari le akhoi dada mari je manupi myam pokpagi makha da polakpagi yam harauna luna toba moise jugola mu sadreba ade ayam phai habe na te ko laikai sina haina reba as isorna moigi mama pa je seba tauna ba makha khara ine na haeba aise ada khoi baba se na as isa se nong chota ba gari tong halingi kaina khoi pa se na haire aise belam leire mai apam bai matungina migi bhenda goi chaning de aina thorga tongaga ma yam magi proud oijaba yam nungai jaba harau jaba ade bhenje leire aina pure mana soran mafang godingi ahan babu mayam je collection torga drop to hole aina as baba pa thau yam tingi da hai mana mamang phame do kai hage das nati isa no patara pok to suru nangi suguma na sa no pim pok na khoi baba je nati ka sumbam pok na phare nang je ngamu pok da kari karam tawrak pano khang din hai madugi wahai je khoi pasina pen man gi dana ba mai thamoi je yam chok thok sera nga sai mi khudingi drop to halini aingonda aina baba thau yam tingi da hai as nang thau do ai happy ge na khoi pagi thamoi da yam na harau jagi ba hai tare adu maina ngasi mak transing je yam na haidi praja singa nungsi birak pa adaidi taseng na harabada akhoi transing je transgender gi bill je kaiguma masi je implement tawira ba thabo oina onthok bira ba trans oiram draba su ohelakadra na khalli as taseng ba maram di kai no da mi je to kimati yang khale e transgender sing je freedom ni ngai ngak ta ngai sele ba akhoi masen thagan na baina te ko haidi transgender sing masa gi hingam na ba mirak tin na ba ngasi wana suro ro su fazana keraga mayam rak tin na bhona je moi transgender gi will jam leyeba adu na moi gi matau tambane hen phare haidi ngausan na ba isa nupi or su ngausan na ba nupam da mayum pandok saru adu na moi dau to na phare ha je soidana hai public na khalak pa matam ni na ismai thamjaninge aduga mo aina mo haininge sina kamai haininge da ngasi tin biri ba mayam jina sum gyan haidi wakhal loksing ade computer gi juk oibani na sum haidi moi knowledge sum henkala kanda akoi transgender hai moi sing je group amani moi sing ji kamai tawni transgender ni ade transgender ase kaino kamai tawno na hai kanda thaina gi halam khakta hairame koi gi mama pa sina nupa mayam po ba aduga mana magi nupi sina concept oiba matam da macha nupi ma pokning hai ba da pokning ba matam sira mana isorda pathna tore nijare player tore aidi isa nupa mayam po ya dai nupi imdi pokning adubu magi macha je nupi di polakte nupa wai poleba magi physical structure di nupa ni adubu ngasagi isor gi gifted ni haigadra adagidi kari ni haigadno magi nupa oina di poe adubu mai wakhalon di nupi oe adugumba mi dune khoina trans haina ngasi magi behavior da kaida khoina mayam na uri ba sing se ado sugumba transing se ngasai miyam na nusi bi pa khangbi ra ko se akhoi gi damak ta di khwai ta gi laibak phai haina aina thamjaningi aduga aina khwai ta gi asa sauna tawja ki je khoi transgender jing gi clinic na ta bai de achaw hospital ne na khan gi ba khoi gi abinash na lakpa kan sida transgender sing gi clinic ama noi gi problem mayam aidi doctor sing da chalaga yeng bada nungai ta ba aduguma mayam da noi gi clinic ama tawtari no yam free orani yam nungai rani na hai matam du da ai je ta saing na ai thamoi ji dai harau man na kap kheba maram di ke no da yengning ba mayam ma putho ga yeng ba ngam da ba mayam su leba paisa na tabani ko khoi gi lairiba phibam sina doctor da sapada khoi gi kai hani khoina haina da bagumba na suma mayam ji ꯂꯩꯕꯁꯦ ꯑꯩꯈꯣꯏ ꯀ꯭ꯂꯤꯅꯤꯛ ꯑꯃ ꯑꯣꯏꯔꯗꯤ ꯑꯩꯈꯣꯏ ꯌꯥꯝ ꯐ꯭ꯔꯤ ꯑꯣꯏꯔꯅꯤꯅ ꯈꯜꯂꯤ ꯀ꯭ꯂꯤꯅꯤꯛ ꯄ꯭ꯂꯁ ꯑꯩꯗꯤ ꯑꯆꯧꯕ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯑꯃ ꯑꯣꯏꯅ ꯍꯦꯛꯇ ꯑꯣꯟ ꯔꯥꯎꯟ ꯌꯦꯡꯕ ꯌꯥꯕ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯑꯃ ꯑꯣꯏꯅꯁꯨ ꯑꯩ ꯊꯝꯍꯟꯖꯅꯤꯡꯉꯦ ꯑꯗꯨꯒ ꯑꯩꯗꯤ ꯇꯁꯦꯡꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯁꯤꯡꯒꯤꯗꯃꯛꯇ ꯑꯩ ꯄꯨꯟꯁꯤꯁꯦ ꯑꯩ ꯀꯠꯀꯦꯅ ꯈꯜꯂꯤ ꯑꯩ ꯇꯁꯦꯡꯅ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔ ꯌꯥꯝ ꯅꯨꯡꯁꯤꯖꯩ ꯑꯩ ꯏꯁꯥ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯅꯤ ꯑꯩꯅ ꯍꯦꯛ ꯈꯪꯕꯗꯒꯤ ꯉꯁꯤ ꯂꯩꯔꯤꯕ ꯁ꯭ꯇꯦꯖꯁꯤꯗ ꯑꯩ ꯑꯗꯨꯝ ꯂꯩꯔꯤ ꯑꯩ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯁꯤꯡꯒꯤꯗꯃꯛꯇꯗꯤ ꯑꯩꯅ ꯉꯝꯕ ꯊꯥꯛꯇ ꯑꯩꯅ ꯈꯪꯖꯕ ꯍꯩꯖꯕ ꯈꯨꯗꯤꯡꯃꯛ ꯑꯩ ꯃꯇꯦꯡ ꯄꯥꯡꯒꯦ ꯍꯥꯏꯕꯒꯤ ꯑꯁꯥꯗ ngasi mayamgi mamangda ai siguma wafam ase thamjari. Thank you.
Inspiring story. He just narrated that before a few decades, we were observed as bad omen, but now our parents are so proud of us because we are the only one who can take care of them when they get old. Because when they have a son, they will get married and live with their wives. And when they get a daughter, she will have a family and live with her husband. And when she has a transgender or a trans man, then trans son, he or she will look after him or her. So that is the way. And secondly, he was saying he is uncomfortable to go to hospital because of his physical conditions, like he's transforming from female to male. So he feels sometimes uncomfortable. So he wants to have a better big hospital rather than this clinic. So I would like to hand over the program to Bonita Pebam.
Thank you, Roro. And I would like to request one of our transgender community pioneer in the film industry. She is the one who is the first one working at the Manipuri film industry. She is none other than Tom Sharma. Please come on the stage and share something. Da Tom, kayo makara share tau biyo ngasi lengbira pagi yam nungai papawe.
Good evening, everyone. I mean, my name is Tom Sharma. I consider transgender ki life stage horror from se kitang matem tam jaram ge. I isini na mapan pok pada ina teres hubani I yama mangane reise. I inau pa maga senpi I kada ani maga. I na schooling to opa matam da is class 8, 9 dai book de is transgender have se kaino karim to khangde. Samla da I behavior se kayumba wakhalolam de dum leiraga so I NCC yorami taekwondo sanarami football sanarami adegi swimming sanarami adeda zum sana ba chapa kan ai se tonga nature ma yawne mayam sina I ngonda usit pi de ba karem ka thai to ba mayam ma sum swimming to ta ga su iroi minna khujen ne khale thalam adegi taekwondo sana ta ga su PT to ba kan dai se karang se gai ba ngam da ba da ge se homo harang nang to sai se nang kisu kana da kana ga phno do no ka na ngonda yam na nungai ta bam ya football sana ba su mai hai football sana se ai se goalkeeper sana me goalkeeper sana ba se dai se ball yam ki de ba ki da ta ga su ai se me am na ya har de ge sum honor ba daw ya to ma de ma ya har la ka no ka na ai gi stigma sum tok bi ra ba hai ta adu ta so ai se class 10 pass it up the gay some sunning by Wakalons of how they Wakalons did. Adegi beautician course a tumbling bahore, tumbling bahota to Yagi family key background say some have but the Kananta support of the back. I not 10 heck pastor up the beautician course of Pakanza, Tushan Japan has a course of Sally, and the infal manunga course of Tushan Japan has a guy say. Makeup tambachale makeup se tamoga halaga practical tamok bakandre tamoga halak podudi ain honening manina yumgi ai kangan tumbam ka gi kangan je khanjela kanda table mem thalaga practical to pulab ain dress rithanda trial to ga makeup sem tawe de ai yaman ai ki mathak ahum suba male ꯑꯍꯨꯝꯁꯨꯕꯁꯤꯅ ꯑꯩꯅ ꯆꯠꯂꯤꯁꯦ ꯀꯗꯥꯏꯗꯅꯣ ꯁꯨꯝ ꯊꯤꯒꯠꯂꯛꯄ ꯀꯥꯟꯗ ꯃꯦꯀꯞ ꯇꯝꯕ ꯆꯠꯂꯤꯅꯦ ꯍꯥꯏꯕꯗ ꯑꯩꯁꯦ ꯌꯨꯝꯗ ꯐꯨꯕ ꯀꯥꯟꯁꯦ ꯀꯣꯛꯁꯦ ꯑꯍꯥꯟꯕ ꯀꯥꯏꯈ꯭ꯔꯦ ꯀꯣꯛꯁꯦ ꯑꯃꯨꯛ ꯑꯗꯣ ꯁꯦꯀꯦꯟ ꯇꯥꯏꯝ ꯆꯪꯕꯗꯒꯤ ꯇꯨꯃꯤꯟꯅ ꯑꯃꯨꯛ ꯗꯤꯄ꯭ꯂꯣꯃꯥ ꯀꯣꯔꯁ ꯇꯝꯊꯣꯛꯎ ꯂꯥꯛꯑꯅꯣ ꯑꯣꯖꯥ ꯃꯌꯥꯝꯁꯦ ꯀꯧꯔꯛꯄ ꯀꯥꯟꯁꯤꯗ ꯇꯝꯗꯤ ꯌꯥꯝ ꯇꯝꯅꯤꯡꯉꯒ ꯑꯗꯒꯤ ꯄꯩꯁꯥꯁꯨ ꯃꯣꯏꯅ ꯄꯤꯕꯤꯕ ꯅꯠꯇꯕ ꯑꯩꯒꯤ ꯑꯍꯥꯟꯕ ꯃꯦꯀꯞ ꯇꯧꯕ ꯆꯠꯄ ꯃꯇꯝꯗ ꯑꯩꯁꯦ ꯃꯨꯁꯂꯤꯝ ꯅꯨꯄꯤ ꯑꯃ ꯂꯨꯍꯣꯡꯕꯅ ꯈ꯭ꯋꯥꯏ ꯐꯥꯔꯁꯇ ꯆꯠꯂꯦ ꯂꯨꯄꯥ 50 ꯈꯛꯇꯪ ꯐꯪꯉꯦ ꯂꯨꯄꯥ 50 ꯐꯪꯕꯗꯨꯅ ꯑꯩꯁꯦ ꯀꯣꯁꯃꯦꯇꯤꯛ ꯄꯣꯠ ꯆꯩ ꯂꯩꯔ ꯁꯤꯖꯤꯟꯅꯩꯌꯦꯕꯀꯣ ꯑꯗꯒꯤ ꯑꯍꯥꯟꯕ ꯃꯦꯇꯔꯤꯌꯦꯜꯁꯤꯡꯗꯤ ꯂꯩꯇꯕꯅ ꯑꯩꯒꯤ ꯂꯩꯀꯥꯏꯒꯤ ꯏꯆꯦꯒꯤ ꯃꯃꯥꯟꯅꯕꯤꯁꯤꯡꯁꯤꯒ ꯌꯥꯝ ꯇꯤꯟꯅꯔꯛꯄꯅꯤꯅ ꯃꯣꯏꯗꯒꯤ ꯄꯣꯠ ꯆꯩꯁꯤꯡꯁꯦ ꯋꯥꯏꯔꯀꯥꯟꯗ ꯑꯩꯅ ꯃꯦꯀꯞ ꯇꯧꯕ ꯆꯠꯂꯦ ꯆꯠꯂꯀꯥꯟꯁꯤꯗ ꯑꯩ ꯁꯨꯝ ꯃꯌꯥꯝ ꯅꯨꯡꯁꯤꯕꯤꯔꯛꯄꯒꯤ ꯃꯦꯀꯞ ꯇꯧꯕꯒꯤ ꯁꯨꯝ ꯅꯦꯛꯂꯛꯄꯗꯒꯤ ꯑꯩꯁꯦ ꯁꯨꯝ ꯆꯠꯄ ꯍꯧꯔꯗꯒꯤ ꯑꯩꯅ 11 ꯀ꯭ꯂꯥꯁꯇꯒꯤꯗꯤ ꯑꯩꯒꯤ ꯁ꯭ꯇꯗꯤꯒꯤ ꯃꯦꯇꯔꯤꯌꯦꯜ ꯃꯌꯥꯝꯁꯦ ꯑꯩ ꯏꯁꯥꯅ ꯄꯩꯁꯥ ꯇꯥꯟꯖꯔꯒ ꯂꯥꯏꯔꯤꯛꯁꯨ ꯑꯩꯅ ꯂꯩꯖꯔꯦ ꯐꯣꯔꯝ ꯐꯤꯜ ꯑꯞ ꯇꯧꯕꯁꯨ ꯑꯩꯅ ꯂꯣꯏ ꯇꯧꯖꯔꯦ ꯑꯗꯒꯤ ꯀ꯭ꯂꯥꯁ ꯒ꯭ꯔꯦꯖꯨꯑꯦꯁꯟ ꯐꯥꯎꯗ ꯃꯣꯏꯒꯤ ꯑꯦꯗꯃꯤꯁꯟ ꯇꯧꯕꯒꯤ ꯐꯣꯔꯝ ꯐꯤꯜ ꯑꯞ ꯇꯧꯕꯒꯤ ꯂꯥꯏꯔꯤꯛ ꯂꯥꯏꯁꯨ ꯂꯩꯕꯒꯤ ꯌꯨꯝꯗ ꯀꯅꯥꯝꯇ ꯗꯤꯄꯦꯟ ꯇꯧꯗ꯭ꯔꯦ ꯑꯩ ꯏꯁꯥ ꯏꯊꯟꯇ ꯍꯣꯠꯅꯖꯔꯦ ꯑꯗꯣ 1995ꯇ ꯑꯩꯒꯤ ꯃꯔꯨꯞ ꯑꯃꯈꯛ ꯊꯦꯡꯅꯖꯩ ꯕꯥꯃꯣꯟ ꯂꯩꯀꯥꯏꯗꯒꯤ ꯑꯩ ꯑꯁꯦꯡꯕ ꯂꯣꯏ ꯍꯥꯏꯗꯣꯛꯆꯔꯒꯦ ꯃꯌꯥꯝ ꯃꯃꯥꯡꯗꯀꯣ ꯑꯗꯨꯒ ꯏꯃꯥꯟꯅꯕꯁꯦ ꯊꯦꯡꯅꯕꯗꯒꯤ ꯑꯩꯒꯤ ꯕꯤꯍꯦꯕꯤꯌꯔ ꯍꯥꯏꯕꯗꯤ ꯑꯩꯒꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔꯒꯤ ꯕꯤꯍꯦꯕꯤꯌꯔꯁꯤꯡꯁꯦ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯝꯕꯤ ꯁꯣꯔꯣꯛ ꯆꯠꯄ ꯀꯥꯟꯗ ꯅꯨꯄꯤꯒꯤ ꯗ꯭ꯔꯦꯁ ꯁꯦꯠꯄꯁꯦ ꯑꯩꯁꯦ ꯑꯩꯒꯤ ꯑꯣꯏꯅꯗꯤ ꯅꯨꯄꯤ ꯃꯥꯟꯖꯔꯒꯁꯨ ꯅꯨꯄꯤ ꯗ꯭ꯔꯦꯁ ꯀꯌꯥ ꯁꯦꯠꯂꯛꯇꯦꯕꯀꯣ ꯃꯌꯥꯝ ꯋꯥꯔꯧꯕꯤꯕꯗꯤ ꯌꯥꯗꯦ ꯑꯗꯨꯒ ꯅꯨꯄꯤ ꯁꯦꯠꯂꯛꯇꯕꯅꯤꯅ ꯑꯩꯒꯤ ꯕꯤꯍꯦꯕꯤꯌꯔꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯁꯣꯁꯥꯏꯇꯤꯅ ꯔꯦꯁꯄꯦꯛ ꯀꯌꯥꯝ ꯇꯧꯕꯤꯕ ꯑꯩꯁꯦ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯁꯦ ꯅꯨꯄꯤ ꯃꯥꯟꯖ ꯇꯥꯔꯒꯁꯨ ꯅꯨꯄꯤ ꯗ꯭ꯔꯦꯁ ꯁꯦꯠꯇꯦ ꯑꯗꯨꯒ ꯅꯨꯄꯤꯒ ꯇꯤꯟꯅꯕꯅ ꯍꯦꯟꯅ ꯇꯤꯟꯅꯔꯝꯒꯅꯤ ꯍꯥꯏꯕꯁꯨ ꯈꯟꯕꯤꯔꯒ ꯅꯨꯄꯥ ꯃꯌꯥꯝꯁꯨ ꯇꯤꯟꯅꯔꯛꯑꯦ ꯅꯨꯄꯥ ꯃꯌꯥꯝ ꯇꯤꯟꯅꯔꯛꯄꯁꯤꯗ ꯑꯩꯁꯦ ꯑꯗꯨꯝ ꯋꯥꯈꯜꯁꯦ ꯅꯨꯄꯥꯒ ꯇꯤꯟꯅꯔꯒꯗꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔ ꯑꯃꯒ ꯅꯨꯄꯥ ꯃꯌꯥꯝꯒ ꯄꯨꯜꯂꯒꯗꯤ ꯑꯩꯁꯦ ꯌꯥꯝꯅ ꯆꯥꯎꯈꯠꯇꯕ ꯌꯥꯝ ꯅꯦꯒꯦꯇꯤꯞ ꯁꯦꯟꯁ ꯔꯣꯝꯗ ꯂꯣꯏꯅ ꯄꯨꯅ ꯂꯣꯏꯅ ꯈꯟꯕꯅꯦꯕ ꯑꯩꯅ ꯇꯤꯟꯅꯔꯤꯕ ꯏꯃꯥꯟꯅꯕꯁꯤꯡꯁꯦ ꯑꯗꯨꯗ ꯑꯩꯒꯤ ꯂꯩꯀꯥꯏꯒꯤ ꯃꯤꯁꯤꯡꯁꯤꯅ ꯅꯪꯅ ꯇꯤꯟꯅꯔꯤꯕꯁꯤꯡꯗꯣ ꯀꯩ ꯀꯥꯟꯅꯕ ꯇꯤꯟꯅꯔꯤꯅೋ ꯅꯪꯅ ꯂꯩꯒꯗꯧꯕ ꯃꯐꯝ ꯌꯨꯝꯗ ꯑꯗꯨꯝ ꯍꯜꯂꯛꯑꯣ ꯑꯗꯩ ꯌꯨꯝꯗ ꯇꯁꯦꯡꯅ 1995ꯇꯒꯤ ꯑꯩ ꯌꯨꯝꯗꯒꯤ ꯑꯗꯨꯝ ꯊꯣꯛꯂꯛꯈ꯭ꯔꯕꯅꯦ ꯑꯩꯁꯦ 1995ꯇ 12 ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯇꯝꯃꯝꯕꯅꯤ ꯑꯗꯨꯗ 1995 12 ꯁ꯭ꯇꯦꯟꯗꯔꯠ ꯇꯝꯃꯛꯄ ꯀꯥꯟꯁꯤꯗ ꯑꯩꯁꯦ ꯃꯤꯁ ꯃꯅꯤꯄꯨꯔ 1994ꯒꯤ ꯃꯤꯁ ꯃꯅꯤꯄꯨꯔꯗꯨꯒꯤ ꯗꯤꯖꯥꯏꯅꯔ ꯑꯣꯏꯅ ꯊꯣꯛꯂꯛꯑꯦ ꯑꯗꯨ ꯃꯇꯝꯗꯨꯗ ꯑꯗꯨ ꯃꯇꯝ ꯊꯣꯛꯂꯛꯄꯗꯒꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔ ꯃꯌꯥꯝ ꯀꯅꯥꯝꯇ ꯊꯣꯛꯂꯛꯇꯦ ꯑꯩꯅ ꯑꯍꯥꯟꯕꯅꯤꯗ ꯊꯣꯛꯂꯛꯄ ꯑꯗꯨ ꯃꯇꯝꯗꯨꯗ ꯑꯗꯨꯗ ꯃꯌꯥꯝꯁꯤꯅ ꯊꯣꯛꯂꯛꯄ ꯀꯥꯟꯁꯤꯗ ꯑꯩꯅ ꯇꯧꯔꯛꯄ ꯃꯣꯗꯦꯜꯁꯤꯡꯁꯦ ꯑꯗꯨꯝ ꯑꯦꯚ꯭ꯔꯤ ꯏꯌꯔ ꯈꯨꯗꯤꯡꯒꯤ ꯄꯣꯖꯤꯁꯟ ꯍꯣꯜꯗꯔ ꯑꯗꯨꯝ ꯑꯣꯏꯕ ꯃꯤꯁ ꯃꯅꯤꯄꯨꯔꯅꯤ ꯈꯪꯗꯦ ꯁꯦꯀꯦꯟ ꯔꯅꯔꯁ ꯑꯞ ꯐꯥꯔꯁ ꯔꯅꯔꯁ ꯑꯞ ꯑꯗꯨꯝ ꯇꯥꯏꯇꯜꯁꯦ ꯑꯗꯨꯝ ꯐꯪꯉꯛꯄ ꯑꯗꯩꯗꯤ ꯑꯗꯨꯝ ꯄꯥꯝꯅꯔꯛꯄꯗꯒꯤ ꯑꯩꯁꯦ ꯇꯣꯝ ꯁꯔꯃ ꯑꯗꯨꯝ ꯃꯌꯥꯝꯅ ꯅꯨꯡꯁꯤꯕꯤꯔꯛꯇꯅ ꯑꯩꯁꯦ ꯑꯗꯨꯝ ꯁꯣꯁꯦꯜ ꯐꯪꯁꯟ ꯋꯦꯗꯤꯡ ꯁꯦꯔꯃꯅꯤ ꯑꯗꯒꯤ ꯇꯣꯉꯥꯟ ꯇꯣꯉꯥꯟꯕ ꯐꯤꯂꯝ ꯏꯟꯗꯁꯇ꯭ꯔꯤ ꯑꯗꯒꯤ ꯗ꯭ꯔꯃꯥꯒꯤ ꯀꯝꯄꯤꯇꯤꯁꯟ ꯑꯗꯒꯤ ꯁꯣꯔꯠ ꯐꯤꯂꯝ ꯃꯊꯪ ꯃꯦꯀꯞꯀꯤ ꯃꯔꯝꯗ ꯃꯌꯥꯝ ꯑꯃ ꯆꯠꯈ꯭ꯔꯦ ꯑꯗꯨ ꯆꯠꯄ ꯀꯥꯟꯁꯤꯗ ꯑꯩꯁꯦ ꯃꯤꯅ ꯔꯦꯁꯄꯦꯛꯇꯤ ꯇꯧꯔꯦ ꯔꯦꯁꯄꯦꯛ ꯇꯧꯍꯟꯕ ꯍꯥꯏꯁꯦ ꯑꯩꯒꯤ ꯀꯦꯔꯦꯛꯇꯔ ꯑꯩꯒꯤ ꯕꯤꯍꯦꯕꯤꯌꯔꯒꯤ ꯃꯈꯥ ꯄꯣꯜꯂꯦꯕ ꯑꯩ ꯅꯨꯄꯤ ꯃꯥꯜꯂꯦ ꯍꯥꯏꯔꯒ ꯍꯦꯛꯇ ꯅꯨꯄꯤ ꯗ꯭ꯔꯦꯁ ꯁꯦꯠꯂꯒ ꯀꯣꯏꯆꯠ ꯆꯠ ꯇꯥꯔꯒꯗꯤ ꯃꯤꯅꯁꯨ ꯀꯅꯥꯝꯇ ꯎꯁꯤꯠꯄꯤꯔꯔꯣꯏ ꯑꯗꯨꯅ ꯌꯨꯝꯗ ꯑꯩꯁꯦ ꯂꯧꯕ ꯂꯥꯛꯑꯦ ꯑꯩꯅ ꯕꯥꯃꯣꯟ ꯂꯩꯀꯥꯏꯗ ꯂꯩꯕ ꯀꯥꯟꯗ ꯌꯨꯝꯗ ꯂꯧꯕ ꯂꯥꯛꯄ ꯀꯥꯟꯗꯨꯗ ꯑꯩꯅ ꯍꯥꯏ ꯏꯃꯥ ꯑꯩꯅ ꯉꯁꯤꯐꯥꯎꯒꯤ ꯊꯥꯛꯁꯦ ꯌꯧꯔꯛꯄ ꯑꯁꯤꯗ ꯏꯃꯥ ꯍꯣꯏ ꯑꯩꯈꯣꯏ ꯕꯕꯥ ꯍꯣꯏꯅ ꯀꯅꯥꯝꯇ ꯁꯞꯄꯣꯔꯠ ꯇꯧꯕꯤꯔꯛꯇꯦ ꯐꯤꯖꯤꯀꯦꯜꯂꯤ ꯐꯥꯏꯅꯥꯟꯁꯤꯌꯦꯜꯂꯤ ꯃꯦꯟꯇꯦꯜꯂꯤ ꯀꯅꯥꯝꯇ ꯁꯞꯄꯣꯔꯠ ꯄꯤꯔꯛꯇꯦ ꯑꯩꯒꯤ ꯏꯌꯥꯝꯕ ꯃꯔꯤꯁꯤꯅ ꯑꯩꯁꯦ ꯌꯥꯝꯅ ꯐꯨꯔꯛꯑꯦꯕꯀꯣ ꯐꯨꯕ ꯌꯥꯕꯁꯨ ꯀꯣꯛꯁꯦ ꯑꯅꯤꯔꯛ ꯁꯦꯀꯦꯟ ꯇꯥꯏꯝꯁ ꯑꯃꯨꯛꯁꯨ ꯀꯣꯛꯁꯨ ꯀꯥꯏꯔꯦ ꯑꯗꯨ ꯃꯇꯝꯗꯨꯗꯁꯨ ꯑꯃꯨꯛ ꯕꯥꯃꯣꯟ ꯂꯩꯀꯥꯏ ꯂꯩꯕꯗꯨꯗꯒꯤ ꯑꯗꯒꯤ ꯀꯣꯛꯁꯦ ꯀꯥꯏꯔꯕ ꯃꯇꯨꯡꯗ ꯑꯩꯁꯦ ꯑꯗꯨꯝ ꯑꯩꯒꯤ ꯁꯤꯟꯐꯝꯗꯨꯗꯤ ꯃꯤꯅ ꯅꯨꯡꯁꯤꯕꯤꯔꯅ ꯅꯦꯛꯄꯤꯔꯕꯅꯤꯅ ꯄꯩꯁꯥ ꯃꯌꯥꯝꯗꯣ ꯐꯪꯉꯛꯑ ꯀꯥꯟꯗꯗꯤ ꯍꯧꯖꯤꯛꯀꯥꯟꯗꯤ ꯑꯗꯨꯝ ꯁꯞꯄꯣꯔꯠ ꯇꯧꯔꯦ ꯁꯞꯄꯣꯔꯠ ꯇꯧ ꯇꯥꯔꯁꯨ ꯑꯩꯗꯤ ꯌꯨꯝꯗ ꯑꯗꯨꯝ ꯍꯟꯗ꯭ꯔꯦ ꯍꯧꯖꯤꯛ ꯐꯥꯎꯗ ꯑꯩ ꯕꯥꯃꯣꯟ ꯂꯩꯀꯥꯏꯗ ꯑꯗꯨꯝ ꯂꯩꯔꯤ ꯑꯩꯒꯤ ꯂꯩꯃꯤꯟꯅꯕ ꯏꯃꯥꯟꯅꯕꯁꯤꯁꯨ ꯅꯨꯄꯤ ꯊꯤꯔꯦ ꯃꯆꯥ 2 ꯂꯩꯔꯦ ꯑꯗꯨ ꯇꯥꯔꯁꯨ ꯃꯥꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯏꯕꯥꯅꯤꯒꯤ ꯔꯤꯂꯦꯁꯟꯁꯤꯗꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔ ꯑꯃꯒ ꯅꯨꯄꯥ ꯑꯃꯒ ꯅꯨꯡꯁꯤꯅꯕꯒꯤ ꯇꯥꯏꯞꯇ ꯂꯩꯃꯤꯟꯅꯔꯛꯄ ꯑꯃ ꯅꯠꯇꯦ ꯁꯝꯅ ꯐ꯭ꯔꯦꯟꯁꯤꯞ ꯑꯣꯏꯅ ꯄꯨꯂꯞ ꯂꯩꯃꯤꯟꯅꯔꯛꯄꯗꯒꯤ ꯑꯋꯥꯕ ꯅꯨꯡꯉꯥꯏꯕ ꯑꯗꯒꯤ ꯁꯣꯁꯥꯏꯇꯤꯁꯤꯗ ꯀꯃꯥꯏꯅ ꯅꯨꯄꯤ ꯇ꯭ꯔꯥꯟꯁꯖꯦꯟꯗꯔ ꯑꯃꯒ ꯅꯨꯄꯥ ꯑꯃ ꯀꯃꯥꯏꯅ ꯂꯣꯏꯅꯍꯟꯒꯦ ꯍꯥꯏꯕꯗꯨꯒꯤ ꯃꯌꯥꯝ ꯃꯃꯥꯡꯁꯤꯗ ꯂꯥꯟꯅ ꯎꯍꯟꯗꯅꯕ ꯍꯥꯏꯕꯗꯤ ꯃꯥꯒꯤ ꯁꯞꯄꯣꯔꯠ ꯑꯩꯅꯁꯨ ꯇꯧꯕ ꯑꯩꯒꯤ ꯁꯞꯄꯣꯔꯠꯁꯨ ꯃꯥꯅ ꯃꯌꯥꯝ ꯇꯧꯕꯤꯕ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯃꯥꯁꯦ photography neba photojournalist hana kano de press le me hosi pudi ma job tawgre adu targa se hosi bauta ma nupi thire ma sa ani le hosi bauta yumda han ge ha basi ju aina no ma tu thira kanda nupa ma nupi thi bhai je ka soi son ngai ke meram lete ke ha de mi gi di magi sagai na te do kala ka do mina de sawam thokte aduna aina magi nupi ang magi macha sing aina rois Lariki maram do egera dress ki maram do aina loi support oi magi nupi du su ibani hana lai relation je khangmani ne kemte understand yam lai ne ibani aduna kemte sawna khona ba kemte laite ado ai sina ai ki personal life ki wari ne aduna aina haga da budi akhoi ki transgender ki oi ba tongan ba health clinic ama hamak pase samna habda yam thine nungai je habdi samna habda aina 2012 ta Delhi da javet habu ki course ama sapa kana je kana nare na pa kan da 4 times ai hospitalized away hospitalized ba kan sida aingon da yam thine torok ba yam bas na seba ne to bolai sak okte na saba su okte have su ki na kem ha de man ngon thaina phuraki du ning jang uraga adagi mana seba to bone laga ising thani have cha haibeng amde kem ta haibeng amde adaida ai na ba chi counseling to ba chi doctor sing ne counseling to ba chi kem to bi de na pampu de pukhalaga brain tb na ha guri pam pizare gonda the brain tb mo rende the general hospital na Punjabi ke hospital kan pukhala ko de gi se khara phare de de khong chapang amam de vision ju effect lai de mitche akupam da hasi puti khara ure duga hana di bit tang ma cha banara me ai tholo pa kan de flight ticket piu ya de ai se ahama de di koma de lei ru ne shiru bani ne ai se coffin ge lei ru bani hospital manung de lenga ai khangan de bida ade ai se gyan tar pa kan sida ai se kamai to manipur thok ta ki khala kan sida ai se disabled da je le ti se ke disabled ha se ti ke ka manipur thok le manipur thok pa de ai se medicine doctor ma ta ka train ai de thai sena thai pa de ngasi pha bu dai ana ba kem ta horak tre aduna ai gi na ba matam da ai ki se sam yam sangam ai sam je marak tu da sam yam sang je ai gi pusen na hona bas dem ai gi yam bas na kem to support to bi de do hai bi ai se si re ni kham da ai gi ai na jawram ba kari memory se khar mang re ko paro ya de life insurance yawram ba sing do nang kara karam do yaram gan hang ai se si do ra bane na ai yam ba sing do ai life insurance kai yaram gin hangame ai se kai te khum de bu ko ai se si do ra ba kai wa khan je khale ba ai sam tang hinga ga di khale hinga kanda ha je kanda di ai life insurance kari kra da mo kai te yaw ko je kai te se yaw bri yawi Brazas Airlines yawi life insurance yawi kanam ta haidokti aina ba da phangado paisa sing do aina transgender ki oiba society ma lairi pasing sida aina loinre ma kathuk sarang gane ba ki paisa mayam do samna harbada aina ngasi tholai ba society sai bu respect to ri ba sing je tori ba sing je kanana ta holino ha ba sidi ai sai thena hona jar to jar ko ne ba ai sana kamaina kamaina ta hol yamna dingang boring loi suramani ado hasiga khoi gi transgender gi ba health center ma hangak ba se yamna nungai jai samna ha ba khoi gi queue le mo matam da khoi se yamna nu param no lebos pharak ta ba nu pim pharak ta ba noirong gi di ka dom no lepte no gan ma usita ba mong de ma ngang pop sing se yamna thengna jare samna ba ticket kak pa sa par thana ma yang ba sa pa ta bokta ticket kak pham je pathom mang khang de na ticket kang kala ba ja de ka dum ge ba khoi se ticket kak pham la pham khang de na adi mara ama de sam sang ma tam da nupa mana ai se noi di somna na ti somna le pon nupi ma te le phale nupi ma le pa se imana ba nupa khang ai se kawrok pa kan da ai gi ming je kawrok pa kan da sungkum khum de to mi kawrok kan ai ta haw no khume to mi kawrok ka je mana ticket to phang na ra be gi ngon da ticket se nupi rom de le pa ticket phang ani kham ti ko ticket se ai na ka e ba ko nupi rom de thu na phang amina aduna akhoi transgender gi oiba health center ma hang sida adugi mati nungai jai masi tung koina akhoi sidri phawda ningsen chamana na akhoi mayam support toraga phajana hangbiragadi masi khudong yam chaba yamna phangani akhoi khakta natna transplant kangu sulai adagi samna da ko inegi macha machu transplant amani machu nupi thana da active service oi leibini aduna machu legi tre leibabudi aduta su akhoi gi family da mana nupa sala nupi sala re aduna akhoi family se machu yum da leite ai yum da leite aduna akhoi gi yum gi support machu support phang da bai chu support phang da aduna ibani se pulap pullaga ibani se wari magi nungai ta bai gi nungai ta ibani share taw minara ga ibani se adum lemine machu legi tre sahi ama hele aduna akhoi haji akhoi transgender sing da ina hajening budi thaba ama tawba kanda akhoi gi punctuality se khara oheninge aduga samna have education ju haninge aduga akhoi amaga mana tawja sai se habe gi mahuta tungna ngangna bai mahuta mana tawse soire habe se masa da jamna request hoina phajana si semdo haninge habe to yam hai haninge samna da akhoi na contribute tawriba akhoi na tawriba contribution se family to so na contribute mayam tawi adagi society to mayam am tawi akhoi na tawriba contribution mayam si kanam da khangbi deba aduna akhoi na ji akhoi gi oiba health sector ma hang pasida hena tung koin hingan ga ta gati akhoi ma se ning je mana badar ka si hai lesson jara
Yeah, this is an announcement. Dinner is ready, so respected sir, madam, and all wish to please, I am requesting to have the dinner, but the community interaction program will continue. So I would like to request Kumarjit Raishram, Secretary of Blessing Giver, please come on the stage and please a short speech on the Transgender Health and Wellness Center regarding this center. And Blessing Giver is an organization which is focused on transgender welfare programs. Now, please come with Kumarjit Raishram for a short speech.
Hi, good evening all. Ngasi akhoi Transgender Health and Wellness Center akhoi Manipur da implemented to hanbagi da makta akhoi Marup Loi Foundation amadi akhoi Manipur State AIDS Control Society pullaga jenim na support auraga sugumba thoramo pangthok pase akhoi transgender community gi oinadi khwaidagi laibak phabani na haizeningi aduga aina haizening ba khara lei akhoi transgender sing se yam tina akhoi singna habada India da akhoi Manipur gi transgender sing je yam tina thauna lei kaigino habada masana masabu self economy da yamna support uzaba thabak pizaba pasatan balom da yamna mang tha balom da sangjan ba atopa lamgi singna habada hijra sing je ga manada ba transgender sing je ga manada ba khunai ma uhalle ba hanthaba pota uhande aduga aina yamna nungaita ba kharasu uzai akhoi gi transgender singjena kari da sugumba dadi makeup ki fashion gi culture gi line dadi yamna hena improve oi aduga akhoi gi government gi oi ba program singda saruk ya ba phangda ba amadi thabak thoram singda kari gi back halino habase aina handak ai samaksu Manipur gi commissioner ne maming di panjararoi aina program amagi damakta koi proposal thaba matam dabu 3 times inquiry tawna namagi damakta thangala thadara taweba file se aduna maram oiraga transgender sing se government gi kari program lege kari skill development lege kari karamba akoina tawba ya training program lege haiba se amata khangdeba India government hape PMKVY gi makhada transgender gi oiba skill development hape adade even social welfare department da sulairi adum department gi oiba sing se khara surumuru loiga loisan gi banga tane ba adubu hausi akoi ai samak na lusingaga business wirem ko lila gi actor do mana president oraga ina secretary oraga khoi gi organization ama form tawe blessing givers haina ga aduna hausi so khoi gi social welfare department na sponsor tawgani moina department na sponsor tawraga khoi gi protection of transgender right to adugi implement tawna na ba khoi seminar ama pangthokani April gi first week ta aduga khoi gi transgender sing se akhoi cooperation pinase support tawna se suguma ma khoi gi health sector da lak pa haibase akhoi gi community da kwai da gi laibak phaba kwai da gi khudong saba suguma ma government na ubi dana mayam na ubi dana suguma ma gi khoi gi thorang paikhalak pase hainingai letana aina mayam gi keno lauraga aina thagat pa phongdok sari aduga government gi khoi gi makok thonglaba officer singsu aigi madam Rosita Habam su leire madam su yamtina khoi government gi site gi aina haizari ba khara chita biraga manasu support obigini na khanjai ado atai aduga sir Abiram su leire aduna akhoi communicate to minase transgender community singse akhoi masen chingdana gumse akhoi masen communication pinadana support tawna kanana la aga khoi jokhat toino akhoi di sengna habada akhoi gi leiri ba phurup se yam banate ba person se yeng ba matamda aduna akhoi mayam marakta gi su hayeng politician ama tholak pa yaye nongmadi soidana aina haise transgender gi kota da akhoi na government da akhoi na request tawgadabani even khoi gi chief minister haksel gi temang da su khoi gi transgender sing gi oiba ka sabi dana adegi sugumba thorang ka pakhat payai adegi atopa department sing da su transgender gi oiba reservation ama only 1% da or 2% da su or su even trans men na khoi gi sibai oiba ke police oiba mayam am yawi ke sukai belaite transgender na su nupi sajara ka su ma police ta thabak tawbada ke sukai belaite any department na thabak tawbada ke sukai belaite aduna khoi gi third gender na leiri se third gender sidagi amu minority third gender na mu leiri ne ba khoi transgender se aduki matik tola bane ba masi se akhoi isan isabu improve to hansi akhoi mayam punjal laga tanaraga cooperation pinaraga government da akhoi na kai doba request oba yage akhoi gi suguma training program hapiu khoi suguma reservation pbu haina akhoi mayam Yahoo sagat minase support minase akhoi gisu isagi right amalai isana isa se right se pizza tragedi kanana right pi doino aduna transgender community mayam ngasi lengbirak liba mayam se isana isabu yam tina strong power mo oiraga ai transgender amani I am very proud to be a transgender haibaga loina na nasana win namaga loina na thabak thoram khudimakta mang thangna sangjan biu aduga akhoi gi sigi khoi gi transgender gi health and wellness ki sigi keno se khodong sab su lobiu hairaga ai samlak pawari se khara haijaba se lesson jarage thank you ma'am.
Thank you, Kumarji Laisam, for your valuable proposals and recommendations. Now, I would like to request our respected Madam Dr. Lucy to have some to deliver some few words on relevant with the Transgender Health and Wellness Center and to resolve this inauguration function of the center. Madam, please.
A very good evening to everyone. I thank this opportunity that is given to me especially on these very auspicious functions that we are having today as we inaugurate the Transgender Health and Wellness Center. I was so used to saying welfare earlier, no? It is a little bit difficult for me in the beginning when I said wellness center, but then all for the good of the trans community. And we are happy that many of the the community are actively, involved in this establishment also. And as we have heard the different stories of the transgenders community, we we believe that these opening of this center will be of much help to the community in different ways, not just in the health sector, but also in bringing more of the community to empower themselves, to bring the more of the community who are hidden and then are not able to express themselves, so that they can come and then avail of the facilities. And in this, I would like to congratulate even Maruploy Foundation, the ITAG, and I also want to congratulate CDC and Manipur SACS for all together holding our hands together to make this program a success. And I wish that it will continue to grow, as the expectation of the community is so much there that this from this small opening of this small clinic, it will continue to grow and to the expectation of the community in the future. Thank you so much.
Thank you, Dr. Lucy. Now, this has come to the end of this inaugural function. May I now request PD Madam and Dr. Melissa to have a group photo with our community people. Yeah, please come. Please come up on the stage. We will have a group photograph. Please come. All the deputy directors, all the organizers, Sanamacha, please come. Avina, please come, please come. Brian, come.
Wait, Tamo, wait.
मदन इधर आओ मदन बैठो बैठो अभी ना आ जाइए अभी ना सिखा लिया
फोटो नहीं आएगा ट्रांसफर लेना